SDPB brings you closer to your government. With gavel-to-gavel coverage of the South Dakota legislature and in-depth reporting from Pierre. Good, useful, and full of wonder. SDPB. From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB.
House Health and Human Services will now come to order. Madam Secretary, please call the roll.
Representative Rayfelt, excused. Vosnes.
Here.
Halverson. Jordan. Garcia. Emery, excused. Andera. Kaiser. Schaefbauer. Manhart.
Here.
Baxter. Heineman. Mulder.
Here.
We have a quorum, Mr. Chairman.
Thank you, Madam Secretary. We have a quorum. The chair will entertain a motion to approve the minutes of our last meeting. Moved by Representative Heineman, seconded by Representative Kaiser. All those in favor will say aye. Aye. All those opposed, same sign. Our minutes are approved. Well, good morning, everyone. Just a few reminders as we begin. Please remember to silence your electronic devices. If you wish to testify, please go ahead and sign in over there at the iPad or on your phone at our House Health and Human Resources site. You can do it there as well. If you have any handouts, please use the pages and they will distribute them to the committee. Also, just a reminder, we are limiting proponent and opponent testimony to 12 minutes per bill. 12 minutes per bill to keep us moving. Even though we have 3 today, that will fill up our time, I'm sure, for the next couple hours. So with that, we'll have our pages come up and introduce themselves. We'd love to hear, again, where you go to school, what your current year is, your plans for the future, and this morning, maybe, again, your favorite Disney movie and why. There we go. Good morning.
Hi, my name is Ella Vandersnick. I go to Willow Lake. I'm a senior. I plan to attend SDSU for early childhood education this fall and get a minor in political science. My favorite Disney movie has to be Ratatouille.
Hi, my name is Hazel Houghton. I am a junior and I'm homeschooled. After high school, I plan to study forensics. And my favorite Disney movie is probably Mary Poppins because I love Dick Van Dyke.
Going back to the classics. Good one. Hey. Well, thanks for being here and helping us run smoothly. All right, if the committee doesn't have any announcements or personal privileges, thank you. I'd just like to say thank you for all the work you guys have put in as a committee. We have 3 bills today. We'll get through them. We have to have them finished today for final disposition, as crossover day is Tuesday. So this is our last official meeting, and I don't think we want to meet tomorrow. So no matter what happens today, we got to get through these 3 bills. So with that, we will jump into House Bill 1160. House Bill 1160, repeal the Medical Marijuana Oversight Committee. Representative Goodwin, come on up and we'll start proponent testimony for House Bill 1160.
Good morning, Mr. Chair, members of the committee. I'm Representative Tim Goodwin. I represent District 30. I'm coming to you with a bill today that I think is a success story. It's actually something that we set up. We didn't know when we started medical marijuana what the parameters were going to be and what we had to do to ensure safety for everybody. And we're going to try to prove you today that we've got all that done. We've got good oversight, and so we can actually shrink government and get rid of one of the committees because it's no longer necessary. So with that, I'll proceed. The Oversight Committee that we're talking about today has completed its original purpose. The committee was created during a program startup to help guide and implement South Dakota's medical cannabis program. It's now fully operational, licensed and regulated, and continuing a temporary oversight structure is no longer necessary. The Department of Health and other state agencies already have a rulemaking authority, enforcement powers, data collection, and reporting responsibilities. Maintaining a separate oversight committee duplicates existing regulatory functions. Repealing the committee reduces administrative workload, staff time and travel cost, redundant meeting and reports, and that is a straightforward efficiency measure that streamlines state government. Repealing this committee does not eliminate legislative oversight. Legislature still retains budget authority, interim committee authority, and statutory revision authority. Medical cannabis policy will continue to be reviewed through the standard legislative channels. Advisory role that lacks decision-making authority. The Oversight Committee makes recommendations only and has no direct regulatory or enforcement authority. Those recommendations already flow through the legislature and executive agencies, making the committee an extra step without added accountability. And I happen to be on the medical marijuana summer studies. I was with medical marijuana from the get-go. And when we first started, like I mentioned, we didn't know where we were at. So we thought we wanted to be safe instead of sorry. So we put this committee in place. But now, like I said, it's a success story. We got good oversight, and I feel it's time just to disband the committee. Thank you. I'll stand by for questions.
Thank you. Further proponent testimony for House Bill 1160. Good morning.
Good morning, Mr. Chairman, members of the committee. My name is Mitch Richter. I represent Genesis Farms on this particular issue. This bill is straightforward. It repeals the Medical Marijuana Oversight Committee. Let me be clear about what this bill does not do. It does not repeal medical cannabis. It does not restrict patient access. It does not weaken enforcement, and it does not change the underlying regulatory framework. What it does do is streamline government. The Oversight Committee was created during the early implementation phase of the medical cannabis program. At that time, it made sense. The state was standing up a new regulatory system, issuing licenses, establishing rules, and navigating unknowns. We are now 5 years later, and that phase is now complete. Today, the program is fully operational. The Department of Health has rulemaking authority. Enforcement authority already existed. Regulatory safeguards are in place. The legislature retains full budget and statutory oversight. The Oversight Committee is advisory only. It does not regulate, it does not enforce, it does not make binding decisions. It makes recommendations that ultimately return this body to executive agencies for action. It does have the authority to, it does not have the authority to propose legislation. In effect, we now have a layer of oversight overseeing a system that is already overseen. This bill recognizes that redundancy and removes it. If at any point the legislature believes the program requires review, we have interim committees, we have standing committees, we have authority to request reports, hold hearings, and amend statute. The power does not disappear with this repeal. This measure is about efficiency and consistency. We do not maintain permanent standalone oversight committees for every regulated program in state government. Medical cannabis should be treated the same as other regulated industries. The LRC likely spent as much time on this committee as it did the property tax force this past summer. The physical expense for the committee to meet can be saved. The program is functioning, the regulatory structure exists, oversight remains intact through normal legislative channels. The bill simply eliminates an extra layer that has outlived its original purpose. I respectfully ask for you to support the bill.
Thank you. Further proponent testimony for House Bill 1160. Further proponent testimony in the room. Do we have any online? We will switch to online, and I will call you by name. So Casey Antwistle, proponent testimony. If you want to unmute and share, turn on your camera. Thank you. Good morning.
Good morning, Mr. Chair and members of the committee. My name is Casey Entwistle. I'm representing myself this morning as I'm a Cook County resident. And this summer, I was also elected as the patient representative of the Medical Marijuana Oversight Committee. And I am going to do a Me Too with the two follow-up, the boys that just spoke. The Oversight Committee has completed its original purpose, and the committee was created during the startup program, and I believe the Department of Health has an A-team on board now, and they can move forward for the patients of the medical cannabis program. So I would encourage you to support this legislation and move forward. Thank you for your time, and I hope you all have a wonderful day.
Thank you, Ms. Antwistle. Further proponent testimony for House Bill 1160 online? I don't think so. Okay. Seeing none in the room or online, we will move to opponent testimony for House Bill 1160. Opponent testimony.
Good morning, Mr. Chairman and members of the committee. I'm Lisa Gennaro with Protecting South Dakota Kids, and I'm sorry I've got a really dry throat this morning, so please bear with me. The Medical Marijuana Oversight Committee was created by the voters in 2020 when they approved the program with almost 70% support. The committee brings together a balanced group of people, 2 senators, 2 state representatives, a doctor, a physician, a nurse practitioner, a police chief or officer, a sheriff or deputy, a counselor or addiction specialist, and 1 patient who uses medical cannabis. This mix gives balanced input from patients, doctors, law enforcement, and other experts. So decisions and recommendations reflect real patient needs, medical facts, and public safety concerns. They meet only twice a year. Their job is to look at how the program is working and give honest advice to legislators and the Department of Health. They check things like Do patients in every part of the state get their medicine quickly and safely? Are the dispensaries and growing facilities doing a good job at fair prices, good services, and keeping things secure? Are things enough? Are there enough testing labs? Are the rules strong enough to make sure only card holders can get and use the medicine? What do the latest studies say about health effects? They talk to real patients, caregivers, pharmacists, school leaders, parents, police, the Department of Health, and others. In their 2025 report, they suggested common sense fixes like fair fines for mistakes, better ways for doctors and patients to work together, more public information about medical cannabis, telehealth visits after the first exam, and better tracking of any safety concerns, the hospital visits, or driving issues. If we repeal the committee, we lose this independent group that listens to everyone and gives clear, balanced service. The Department of Health runs the day-to-day rules, but the committee adds extra eyes for patients, doctors, and law enforcement to make sure the program stays safe, fair, and helpful. I'm also going to have the pages just hand this out real quick to everybody. We have, obviously, there's other states that are doing this, and I'm just handing you a sheet of paper that kind of gives you the other states that also have committees like this. I'm just asking you to please vote no on this bill. I think it's something that we still need here in our state. Thank you.
Thank you. Further opponent testimony for House Bill 1160. Opponent testimony. Okay, seeing none in the room, I believe we have some online, and again, I'll call your name. Ms. Milstead.
Thank you, Mr. Chairman. Can you hear me?
Yes, we can hear you.
Awesome. I appreciate the time that for you to hear my testimony this morning. And I want to read you something from the statute that was put into effect in 23. And this is where primarily my concern is. Any research studies regarding health effects are part of the duties of this committee, and any medical and clinical aspects of the program are also part of the duties of this committee. The statute also says that the committee shall ensure that it seeks relevant input from qualifying patients, designated caregivers, pharmacists, school boards, administrators, parents, municipal representatives, state agencies, including DOH, Department of Criminal Investigation, DPS, and medical cannabis establishments. I believe, honestly, I went to the meetings in 23. I listened online in 24, and I was at all three meetings in 25. And this is the first year, honestly, that statute and those items have been actually pursued and identified. If you look through the minutes, if you look through the agendas, the first couple of in 23 and 24, you'll see that it was primarily DOH and the industry that talked about back doors, front doors, cameras, testing. They identified parts of the program and how they were working or how they weren't working, but there was no research involved. There were no broader stakeholders involved. The agendas were thrown out online, and people were if they saw them, they might come. DPS actually invited themselves at the very first meeting. They weren't asked to come. And now you had a chairman who actually put an agenda out there and invited people who had done research, school administrators, pharmacists. You had parents, pharmacists, you had patients, you had representatives. We had DOH, DCI, DPS, all represented in those three meetings. And it was concerning to me that the industry fought back and made this contentious when it should honestly be about protecting the public and protecting the patients. And all of these people that testified, you had a psychologist, a psychiatrist, an ER doctor, a gentleman who works with drugs from Missouri. You had the school administrator from Sioux Falls. All of those people should have had input, and this was the first year that they actually did. So I think that we're a long way from making this program as effective as it could be. All of these people that testified weren't there to get rid of our program. They were all asked, how can we make our program better? And that's what this oversight committee is. Every day you see more research coming out. There were 3 studies put out this week on the health effects of medical marijuana, of marijuana in general. And those things need to be on the table every single year to make sure we have the best program possible. That's why this committee is important. There was, I'll call it spitefulness. It was at the end of the November meeting that Genesis Farms lobbyists got up and said, we're going to get this committee repealed. If you want to go back and listen to the minutes of all of the meetings, you'll see that the industry had plenty of representation and plenty of time to speak. The chairman very graciously gave them at least half time, if not more, at the last meeting. And so it's unfortunate that it got to be so contentious. It's about making it a good program. It's not about getting rid of it, but we need to pay attention to the health and safety of not only the patients and the public, but our children. So please vote no on this, keep it going. And keep a good committee going that actually wants to look at research, to look at our medical community and see where we can do better. Thank you.
Thank you. And I know I called your name, but could you just state your name for the record one more time and who you're representing?
Yep, Rhonda Milstead, and I was representing myself.
Thank you. Further opponent testimony. Further opponent testimony for House Bill 1160. Seeing none in the room or online, we will move to rebuttal. You're handing that off. The prime is handing that off. Go ahead and state your name.
Thank you, Mr. Chairman. Mitch Richter with Genesis Farms. The last 3 meetings of the Summer Oversight Committee, there was a lot of testimony. The vast majority of it was from out of state. There was a law enforcement officer from Missouri that was undercover in the 70s that told us about 50-year-old marijuana laws. Ms. Milstead stated the need for data and reports and new information that comes. That's no different than what you do every year here. We bring a bill, we bring the data that comes with the bill that to make its case. This is like any other regulated industry in South Dakota. The program is set up, it stands up on its own. We're regulating it now. You can bring a bill, you can bring your data and make the case for or against whatever the program is. But 70% of the people voted for this. They put it in place, and we would just ask that we remove the Medical Marijuana Oversight Committee and we move forward. Thank you.
Thank you. With that, we'll close rebuttal and go to committee questions. Do we have committee questions? Seeing no committee questions. Representative Shapepower.
For the prime, thank you, Mr. Chair. What would be the harm of keeping this committee intact?
Yeah, Mr. Chair.
Go ahead.
Thank you, Mr. Chair. I'm not looking like there'll be any harm. Of course, there wouldn't be any harm. It's just a way to reduce government for an unnecessary agency. We got everything, I think, covered. And I think it was good to have it that way. I'm not saying we should have never had this before, because when we got into this, we didn't know what we were going to be up against. And things ran so smoothly that we just think it's time to disband it. But to answer your question, ma'am, there is no harm if we keep it going, other than the bureaucracy of keeping an agency going that we probably don't need.
Could you just, for those online, state?
Oh, I'm sorry, Representative Tim Goodwin.
Do you have the cost of this committee? Do you know what the cost is per year?
I do not, Mr. Chair, I do not have a fiscal on that. No, I do not.
All right, any other questions? Any other questions? I have one for the opposition, Mr. Gennaro, if possible.
Mr. Chair, Lisa Gennaro, Protecting South Dakota.
Thank you for being here. You know, obviously the proponent stated, you know, it's done its job at the point setting up the program, standing up the program, moving forward. You know, these committees, again, I don't know if they should last in perpetuity or last forever. So what do you believe are the markers that would signal, okay, now it's time to go ahead and repeal the committee versus keep it going on forever?
Well, I think because it's such a big, obviously, issue, not just here in our state, but across the country, and to answer your question on how much it costs, I did look that up. And they give the legislators so much money per day when they come here. But total, that the cost typically is, for the whole, all the members meeting is about $1,000 to $3,000 for that day when they come together, is what they're showing. But I don't see the harm in keeping something that's costing $1,000 to $3,000 a day when we know that medical marijuana and even recreational marijuana is obviously at the forefront also. To get together with the doctors or representatives, legislators, you know, police officers, because they're on the ground, they see what's happening. The patients see what's happening. Yes, you guys get together once a year and you make great decisions on things, but having people on the ground and getting together twice a year, I don't think is anything that's harmful. Did I answer your question?
No, I don't.
Not really?
Not really.
I don't know
Again,
if
what are
there's
just the markers, like the indicators to say, okay, now we know it's time to repeal the committee?
I you know, there again, I think that would come with the people that are actually doing the committee. I would have loved to hear from all of the people that are sitting on the committee right now on what their views are. I'm not the expert in that. They are. And I think it would have been great to hear what they all had to say besides just the patient.
Okay.
So,
Thanks.
sorry.
All right. Do you have a question? With that, we'll close questions and move to action and/or discussion. Action and/or discussion. Representative Garcia.
I didn't even say anything, Mr. Chair, but you saw me looking at you.
I saw your light go on, yes.
Yeah. Well, thank you, Mr. Chair and the committee and people. I actually am, or was, the chair of the Medicinal Marijuana Committee. So the reason I didn't get up to be a proponent of continuing is I just felt I'd make it in comments to move it along. If you had the time and listened to the actual 3 committees, which were horrific, I will say it was horrible, quite contentious, had police officers in there undercover because it got very hostile. The environment was not a very friendly environment. The issue is several things. If you look at the final submission of what I gave to the executive board at the end of the 3rd meeting, it states there clearly why the committee needed to be continued at least for I don't know how long. The PMDP, the monitoring program, has not been up and running correctly. We have over 11,000, maybe we're up to now 13,000, roughly less than 15,000, let's say, if I'm going to be held to a number, of registered medicinal marijuana card holders. We don't have a digital system in, even though a great work with the Department of Health. That was the issue on the Department of Health. We don't have any way to monitor or the law enforcement to really pick them up or find out if they do have a card or not. That was one of the big major ones, because if it is a class 1, it should be monitored like any drug, and it was not done. The other issue is the public demanded to know where the status was. Yes, they are correct. 70% of the voters voted for medicinal marijuana. However, that, if asked again, probably would not be what it is today. Because medicinal, I believe the public is thinking other things, not recreational. So for the medicinal point, we didn't have any checkpoints. The third thing is, where it got hostile was the labs. We needed to know the 2 labs in the state, which we do know are proficient and excellent. They testing the products and are the medicinal marijuana people getting it through the correct dispensaries, and is it safe? What we found from the labs was that, yes, they're testing, but they could test for 2 other things that they're needing to do, which we didn't bring any legislation this term for, but we identified that they're not testing for all the components, but that they are excellent labs. I think I'm on number 3 or 4. When it comes to who's implementing it and how, it was going into facilities like hotels or stops, whatever you want to call them. They were not being monitored. The people that are needing the medicinal marijuana really need to be monitored, and they were going once a year. If you're on a blood thinner like Eliquis or Plavix and you take medicinal marijuana, you will clot. These things were not discussed. That's why we had doctors, ER physicians, people that had come in to say, this is what we're seeing in the ER, this is why it needs to continue to be monitored. And lastly, the psychological, the mental detriment. We are now knowing that sometimes we have psychoses. We have things that are induced with the marijuana. So we want to make sure the dosage was correct. There is no therapeutic index for medicinal marijuana. So there's no way to regulate like a Xanax or something else. You don't know, or digoxin. You don't know how to get a level on it. So these were the things that we identified, which were never discussed or even explored in 2020 when this program was developed. I believe the program had a good intention to develop an oversight, but there was no foresight to know what was coming down the pike. And that's where the committee needed the 3rd meeting, because there was just too many things that were not planned out. And that's what happens when you develop these oversight committees. You say, okay, we're going to monitor it, and then we're going to let it fly. At the end of my discussion with the executive board, I did think that the committee needs to stay intact, but perhaps change gears to monitoring instead of an oversight. But all of those things in the oversight needed to be implemented, which we still do not have. Senate Bill 90 is coming to our actual committee next week, and that is the one where we have passed in the Senate, where we now have identifying markers on the card. We didn't have anything from a date of birth or address or gender. It was very vague on the cards, and that is another issue that the pharmacy department wants on there. So we got that through the Senate, hopefully get through the House. So that all correlates into the digital card, which was so important to have, because we have nothing monitoring right now other than a piece of paper once a year, annual reasoning why you get a card. And I don't want to, just a little latitude here. So the other issue is it got hostile, because when you're asking these hard questions, when you're bringing in science into the actual committee, people don't want to hear that. And I just want to make sure that we are abiding by medicinal marijuana and not a Trojan horse for recreational marijuana, which is not what the people wanted. So I'll stop there and say, and if you have any questions, but I did not get up to be a proponent, because I just felt it was easiest to make the comments. So thank you for your time and listening.
Thank you, Representative Garcia. Further discussion and or action on the Representative Andera.
Mr. Chair, may I move to do pass?
Yes, we have a do pass motion for House Bill 1160 by Representative Garcia.
Wait. No, that's not what I want. Send it to the 41st day. Oh, gosh.
Second.
Okay. You don't second that?
Second.
All right.
I'll second it.
We will allow the misstep. I'm sorry about that. I am. Okay. We're gonna retract that and go back to. We have a 41st day motion for House Bill 1160 by Representative Andera and a second by Representative Jordan. Comments on that motion?
Thank you, Mr. Chair, and thank you for the latitude. I was also on the Medical Marijuana Oversight Committee. What I saw was collaboration between agencies and all stakeholders. Everybody was there. It's unfortunate it got contentious, but the goal of the committee was not to repeal medical cannabis in the state of South Dakota. It was to ensure that we had a disciplined program around marijuana, medical cannabis. We discovered so much. And as maybe you know, maybe you don't know this, but the good representative who is the chairwoman of the committee, she was going to be bringing a bill for digital cards. And it was because of the Medical Marijuana Oversight Committee that really prepared all of us, seeing that we were missing a lot. And for those conversations to open up with the Department of Health. And then the Department of Health reached out to the chairwoman and said, you know what? We heard you guys. We're on this, and showed her everything This is still needed. Will it someday possibly be, gone? Maybe. But right now, I just don't think it's a wise move. So that's why I want to send this to the 41st day. Thank you, Mr. Chair.
Thank you, Representative Rayfeld.
Thank you, Mr. Chair. Well, I'm going to resist the motion, and my reasoning comes from a different place, and I thank you, that those of you that have served on the Medical Marijuana Committee recently, because it's not easy. I did it for several years, and my really reasoning for supporting the motion is that my experience was we would do all the work on the Medical Marijuana Committee, we'd make recommendations to the legislature, and 95% of the time, those recommendations were not really respected or they weren't fruitful, is how I like to put it. And so if we're not having a committee that is having impact and people are listening to the input and actually taking action with it, I just find it hard for me to want to continue on and do the work of the legislature and the LRC if that's the case. So I don't want it to be by any means demeaning to the work that you've been doing, because I do think it has value, but I want to make sure that it has value to the state on top of it, and having less government, I think, in this situation is good.
All right, further comments on the 41st day motion for House Bill 1160. Representative Jordan.
Thank you, Mr. Chair. The reason I seconded it is if you listen to it and then look into the medical marijuana industry, we basically have recreational marijuana in South Dakota. It's not medical. According to the Department of Health, from stuff we got last year from previous bills, we have about 10,000 medical cards and 100,000 daily users or regular users. That's not medical, that's recreational. The reason it's getting so contentious is because the marijuana industry knows that, and they don't want this oversight committee because they don't want it to be medical, they want it to be recreational. Thank you.
Thank you. Further comments on the 41st day motion. Representative Shapar.
Thank you, Mr. Chair. I'm going to support the 41st day motion. If at max, it's $3,000 a day, and if you have two, or three, in certain years in committees, that's less than $10,000 a year. And I think that is probably a pretty good investment in the safety of our state. These committees are set up so they can look in depth at the issue at hand, whereas, the legislators that aren't on these committees, they don't always, look in depth. So we trust their expertise and, or just their research on this. And so I think for less than $10,000 a year, I mean, good grief, we spend millions and millions of dollars on things that are not needed in our state. And I think this is just something that we should continue on, because yes, the pathway from medical marijuana is to recreational. So that is my view.
Thank you. Further comments on House Bill 1160 and the 41st day motion? Seeing none, we will take action. All those in favor of the 41st day motion moved by Representative Indira, seconded by Representative Jordan, will say aye. All those opposed will say nay. Madam Secretary, please call the roll.
Representative Rayfeld. No. Fosnes.
Nay.
Halverson.
No.
Jordan.
Aye.
Garcia.
Aye.
Emery.
No.
Andera.
Aye.
Kaiser.
Aye.
Schaefbauer.
Aye.
Manhart.
Aye.
Baxter.
Aye.
Heineman.
Aye.
Mulder.
No.
8 ayes, 5 nays.
Having received the majority vote of members elect, House Bill 1160 will move to the 41st day. Thank you. Up next, we have House Bill 1163, prohibit certain persons from requiring genetic-based vaccines or vaccinations. We will start the clock for proponent testimony when Representative Andera is ready.
Chair.
Go ahead and introduce yourself and we'll start.
Thank you, Mr. Chair. Representative Andera, District 10. I want to thank the chair and the members of the committee. House Bill 1163 is to prohibit certain persons from requiring genetic-based vaccines. This is a very clear bill that specifically excludes certain groups. These groups were excluded deliberately and with mindfulness. The groups excluded are found in Section 7 specifically. They are South Dakota National Guard, Childhood Vaccination Schedule, Hospital Personnel, Board of Technical Education, Board of Regents, and Community Support Providers. The bill also ensures anyone with active cases of tuberculosis, smallpox, etc. are also excluded. The bill itself does a very good job at identifying exclusions, so I would refer to the bill's contents for a full description, full list. So why bring this bill and why now? Because more and more information is coming out, not only about the COVID-19 vaccination campaign, but how the states and ultimately the world handled and identified the event itself. Some of us have received letters with false information stating things like any vaccine prevents or lessens the severity of the illness to which that person was immunized and stops the spread of that disease. That is simply not true. A perfect example of this was the COVID-19 mRNA vaccine. It was neither safe nor efficacious, and studies are pouring out indicating this claim is holding more and more weight. I have never personally demanded someone get a vaccine or not get a vaccine. I feel the most important principle anyone can emulate is self-discipline as well as personal sovereignty. If one wants to get a vaccine, they should get it. However, no one should be forced through coercion or manipulation or punishment of any sort. We must ask ourselves, is an event like this possible again? Many of those who did not want a mystery solution to be injected in their bodies were out of luck. Take this injection or lose your job, be ostracized by your family, or be told we don't serve your kind. But the courts are beginning to differ. On July 3rd of 2024, a woman from Tennessee was awarded $700,000 for being fired after refusing to be vaccinated. Another woman in Michigan was awarded $12 million in November of 2024 for refusing to be vaccinated and fired. I am not here as an anti-vaxxer or a vaxxer. I am here to share facts, and I am here to ensure South Dakota does its part to protect the rights of our citizens to choose what they put in their bodies and whether they have certain injections given to them as a standard when there may be other options. I would presume that not a single one of us in this room wants to go through that COVID pandemic again and everything that came along with it. It is time for mindfulness, and it is time for us to work together through the sharing of information, not the censorship of it. The World Council for Health on November 29, 2021, issued a declaration demanding that governments and corporations cease and desist from direct or indirect participation in the manufacturing, distribution, administration, or promotion of COVID-19 vaccines, experimental injections. At the time, they were considered experimental, based on serious safety concerns. Then, on January 4th, 2024, 3 years later, the Florida Surgeon General called for the removal of all mRNA COVID-19 vaccines from human use because contamination by DNA fragments and the risk of genotoxicity. So in conclusion, I am bringing this bill because I support the people of South Dakota in science. Science is not quick. It never has been, and it never will be. It can take years to test a hypothesis depending upon inputs. If there is no input, there is no science, only questions and postulations. We now have inputs to assist us in what I would consider the actual hypothesis. Do genetic-based vaccines help or harm? Are genetic-based vaccines effective or not? Whether a simple hypothesis or a complicated one, is it safe? Will this happen again? Can I trust mRNA vaccines, genetic-based vaccines? Can I trust the guidance I am receiving? Is it accurate and is it true? The post-market evaluation studies are coming out, and it's time for protections for the people of South Dakota who do not want to participate and for penalties to be levied for parties who take unconscionable action towards those who want to control what they will or will not put into their bodies. Thank you for your time, and I respectfully request a do pass from the committee. Thank you very much. I stand by for questions.
Thank you. We have about 7 minutes left for proponent testimony for House Bill 1163. Proponent testimony in the room for House Bill 1163. We have someone coming behind you.
Good morning, Mr. Chair, Committee. My name is John Coonery from District 11, Sioux Falls, and I'll just be very brief. What we've discovered since the rollout of mRNA vaccines from 2021, there's some very highly respected world doctors and scientists. I'll just name a couple. Dr. Andreas Novak, who's a biochemist from Germany, top cardiologist, internist Robert Peter McCullough from Texas, Dr. Peter Cole, he runs one of the largest pathology labs in the Northwest. And these all have said that there's extremely high rates of adverse effects and in many cases deaths as a result when this was rolled out. Former Pfizer scientist, Dr. Michael Yeadon, says that mRNA vaccine hydroxide, which is encapsulated in injections, aren't truly vaccines in the traditional sense. They don't provide protection from diseases and don't stop transmission and cause extremely high rates of permanent adverse health effects and deaths. And I know personally some people that has, and I will speak to that in the next bill. These mRNA vaxes should not be forced on anyone, and so I support this bill. Thank you.
Thank you. Further proponent testimony for House Bill 1163. Further proponent testimony in the room? Seeing none in the room, do we have any online? No proponent testimony online for House Bill 1163. With that, we will close proponent testimony and reset the clock for 12 minutes for opponent testimony for House Bill 1163.
Morning, Mr. Chair, members of the committee. Tim Rave, representing Sadaho. While we respect individual choice and support patient and employee rights, and I think it's important to note here, employees do have rights today. They have religious or medical exemptions to getting vaccinations. We actually have about a 6.8% exemption rate across the state. We're actually higher than Minnesota, who has no regulations on that. So I want to be very clear, employees have rights today. This bill would create serious and unnecessary barriers that directly threaten our ability to keep patients safe and keep our facilities open and fully operational, both today and in the years ahead. The narrow exemption for healthcare facilities, we believe, is not enough in this bill. Because just exempting out healthcare facilities doesn't help us with the exemption that applies only if failing to require a genetic-based vaccination would violate CMS or CDC regulations versus compliance with conditions of participation. In reality, most hospital staff vaccination policies, including annual influenza vaccinations, are not federally mandated. They're set by the facility itself based on evidence-based infection prevention guidelines from the CDC, the Joint Commission, and infectious disease experts. Accreditation standards required for Medicare and Medicaid payment. The need to protect the most vulnerable patients we serve. That includes newborns, NICU patients, cancer patients, transplant patients, I could go on. If this bill passes, hospitals would be prohibited from requiring any mRNA-modified vaccination unless CMS or CDC rule forces us to do so. That is an extremely high and unrealistic bar. I will stand down, Mr. Chairman, stand by for questions to ask you oppose the bill. Thank you.
Thank you. Do we have further opponent testimony for House Bill 1163?
Good morning, Mr. Chairman, members of the committee. My name is Justin Smith. I'm an attorney from Sioux Falls. I'm the registered lobbyist this morning for the Infectious Disease Prevention Network and the Greater Sioux Falls Area Chamber of Commerce. So just in general, what's the top line here? Not only does this legislation jeopardize public health, it also infringes on the business decisions of private entities. This bill is government overreach into private business decisions. It tells private employers what safety policies they cannot adopt. It would impose state mandates on business operations, plain and simple. Decisions about how to manage workforce health and liability should be made by employers and small businesses, not by state government. We are a free market state here in South Dakota. If you disagree with your employer's policy requiring specific vaccines, whatever the reasons are why your employer adopted those policies, you are free to get a job elsewhere. If you disagree with a business's policy of mandating vaccines, you're free to take your business to another company. Let me give you an example of a situation where a small business or an employer might adopt a vaccine requirement, even for an mRNA vaccine. There are small businesses in this state where you have one employee who works for that business who is immunocompromised, whether because they are in the middle of cancer therapies or whatnot. They are at greater risk of infection with diseases than the rest of us. And because of that, because this business values their employees, they adopt a policy saying you must get this vaccine. That's one example. That would be criminalized under this bill to the tune of a $10,000 civil penalty payable to the Attorney General. Again, this bill infringes on our sacred institution of employment at will in South Dakota. And every time you take a slice out of employment at will, it makes it more and more difficult for that concept to still be legitimate in South Dakota. Local school boards, hospitals, and county governments would lose the ability to set policies tailored to their communities. This replaces local decision-making with one-size-fits-all state intervention. It also interferes with the rights of healthcare providers to protect vulnerable patients. While this bill does try to exclude some healthcare facilities and providers, others are not specifically excluded, like long-term care facilities, cancer centers, and clinics, and they may need specific vaccination policies to protect employees and high-risk individuals. This addresses a problem that no longer exists. It's very rare these days to see a requirement for a COVID-19 vaccine or mRNA vaccines generally, but passing new broad restrictions creates more bureaucracy without solving a current issue. As Mr. Rave talked about, this could jeopardize public health, so I won't go into that, but I want to make two remarks in response to some of the proponent testimony. If we have people that are currently recovering millions of dollars against their employer over vaccine policies, without laws like HB 1163, we clearly do not need a mandate to protect against those kinds of abuses. This bill limits the remedy that an employee could recover to a $10,000 civil penalty that doesn't even go to that person, it goes to the Attorney General. This is a slippery slope. If an mRNA vaccine today, what other vaccines are next? What other mandates on small businesses and employers will be allowed? This is a bad public policy, and for businesses and others, we'd ask you to please defeat the bill. Thank you.
Thank you. We have about 6 minutes, 30 seconds left for opponent testimony. House Bill 1163.
Good morning, Mr. Chair and members of the committee. I'm Kim Elson-Reisden with Avera Health. We're asking you here to oppose House Bill 1163. I would just associate myself with the comments that you've already heard from other opponents of this bill. I just want to add a couple of other contextual points. In just a few weeks, it will be 6 years since South Dakota had its first COVID cases. I know that because I served as the Secretary of Health and I had to help make that announcement along with Governor Noem at the time. Since then, 13 billion COVID vaccines have been provided throughout the world. 13 billion. Where are the studies showing the harm that a bill like this would actually help address? You're not seeing the studies because they don't exist. Why are we relitigating the COVID response that started 6 years ago? I just have to ask that question. You heard the prior testifier talk about where are these COVID vaccines being required today? Those are legitimate questions. Why are we bringing legislation to address problems that do not exist today? I would just ask you to vote no on this bill. Thank you.
Thank you. Further opponent testimony for House Bill 1163.
Good morning, Mr. Chair, committee members. Allie Dawes on behalf of Sanford Health. We would respectfully ask you to oppose House Bill 1163. Just a few main points that I want to hit on that you've heard a little bit about. But many hospital patients cannot be vaccinated themselves. Even mild illness in a staff member can be life-threatening to a medically fragile patient, like you heard from some of the previous speakers. Healthcare workers have a professional duty to do no harm. Taking steps to prevent transmitting disease infections is part of that responsibility. Some vaccines are required or strongly recommended for healthcare workers by regulatory bodies or accredited organizations. Hospitals adopt these requirements to stay compliant and maintain quality standards. For those reasons, we'd ask for your opposition on House Bill 1163. Thank you.
Thank you. Further opposition testimony for 1163. About 4 minutes, 30 seconds left.
Good morning, Mr. Chair, members of the committee. Apologize for the voice. Alan Solano, Monument Health, Rapid City. Has been stated already by the other opponents, so I'll try not to repeat, but Monument Health is really focused on patient care and safety. And when we're looking in departments such as NICUs, cancer care, as such, where we truly have immunocompromised patients, we have to put their care at the utmost level. We try to certainly accommodate the religious, ethical exemptions that any employee, our physicians, our caregivers would bring forward. But House Bill 1163 really removes that ability as we look at these critical care areas. House Bill 1163 tries to predict what the next highly contagious, deadly disease may be and what the response that's required to address that. The carve-out in Section 7, although that's appreciated, really does cede our local control to the federal agencies, such as the CDC. With that, I would ask for your opposition to House Bill 1163. Thank you.
Thank you. 3 minutes left for opponent testimony. 1163.
Mr. Chair, committee members, Doug Abraham, registered lobbyist for the South Dakota Association of Specialty Care Providers, which is the physician-owned surgical hospitals, and the South Dakota Retailers Association. As far as the surgical hospitals are concerned, I'd echo the comments of the prior speakers. In regard to the Retailers Association, as Mr. Smith had indicated, his hypothetical was reality for many of our small business owners. We had multiple members that were very small business owners who had mom and pop shops where one of the owners was immunocompromised. They had to make that very tough decision as to what they were going to require for vaccinations for employees. And that's not an easy decision, especially when you have an employee who's threatening to quit if they're required to get a vaccination. But we're a right to work state. We put the power in the hands of the employer, and bills like this flip the script there, and they create an equity interest in that employee, which flies in the face of everything we are as a right to work state. Those are tough decisions for small businesses, but we need to maintain the power in those small businesses to determine what's best for them. And as a right to work state, you've got a right to go work somewhere else if that doesn't fit your ideology or your needs as an employee. So we'd encourage your opposition. Thank you.
Thank you. Further opponent testimony. Just about 2 minutes left.
Thank you, Mr. Chair, members of the committee. My name is Craig Mattson, and I'm a registered lobbyist for the South Dakota Pharmacy Association. A couple reasons we rise asking for your opposition to this bill. First, community and independent pharmacies are excluded from the healthcare carve-outs. While the sponsor has carved out some exemptions, community and independent pharmacies are not clearly carved out. In many areas, we are the only medical touch point that they have in South Dakota. And the community pharmacy owners are responsible for protecting their patients, their employees, and their ability to remain open and staffed. HB 1163 restricts the ability to manage the risk in a way that aligns with public health guidance and professional judgment. Pharmacy staff have constant close contact with medically fragile and immunocompromised patients. The HB 1163 would limit the pharmacy owner's ability to set basic workplace safety standards. This places small patient-facing healthcare businesses in an impossible situation of whether to comply with the state law or put out patient safety. So it's a concern. Second thing is the carve-outs don't fix the underlying problem. These carve-outs do not resolve the core issue of the bill. They create inconsistencies across healthcare settings, confusion about who is and who is not protected, and patchwork rules that fail to actually deliver in community-based settings. I heard your bell go off, sir, so I'm wrapping up, but we think that this is not good for rule settings, and we are really concerned about the carve-outs that we don't have. So thank you.
Thank you, and I know we have some Me Too's in the room and then online as well. So, real brief, thank you.
Mr. Chair, members of the committee, Garth Wadsworth with Elevate Rapid City. I'd ask you please read section 2 very closely. It ends with any other technology utilizing genetic material. I think you could argue that that would include the old school vaccines, chickenpox, MMR, who use viral genetic material to induce an immune response. I don't think that's the intent, but I do think it would be included in this definition. Thanks for your opposition.
Further Me Too's.
Morning, Mr. Chairman, members of the committee. My name is Justin Bell. I'm an attorney from Fort Pierre, and I represent the South Dakota State Medical Association. We would stand in opposition to this legislation and associate ourselves with the prior opponents and simply state that this bill doesn't even, we don't know what diseases this would actually apply to. We should not pass this legislation. Would ask that you defer it for a first day. Thank you.
Thank you. Further Me Too's for House Bill opposition to 1163.
Thank you, Mr. Chair, members of the committee. Terry Dosh. I'm Executive Director, South Dakota Council of Community Behavioral Health. Respectfully, Me Too.
Thank you. Me Too's in the room.
Mr. Chair, members of the committee, Sam Nelson, South Dakota Association of Nurse Anesthetists, Me Too.
Thank you, and I believe we have one online. I'll call your name when we're ready here. Carmen Toft, and we are past the point of full testimony, so just a quick Me Too, and that'd be great. Thank you.
My name is Carmen Toft, American Families for Vaccine Action Fund and South Dakota Families for Vaccines, Me Too.
Thank you so much, Ms. Toft. With that, we will close opposition testimony and move to rebuttal.
Mr. Chair. Representative Vandera, District 10. Very, very interesting discussion, but nobody mentioned the people. Nobody mentioned the employees who were forced. Either you put this in your body, or you are fired, or you are deboarded, or you are penalized in some way. Why is this both ways? I'm just curious, because all of that punitive action that happened, and we are not relitigating COVID-19 pandemic. What COVID-19 pandemic, why it was brought up is because we needed historical context to what happened. The discrepancies and the unconscionable actions taken by some employers for people who simply said, I don't feel this is safe. I don't know what's in it. I don't know if I'm allergic to it. I don't know what this is. So, but let's talk about them. Where is their help and their support? So we talk about how we have, medical exemptions, and we also have, religious exemptions. Okay. So basically what this is doing, this is saying if someone comes to you and says, look, I do not want to have a genetic-based vaccine. What are my other options? There are other options. We should not force something into people as terms of employment or to keep employment just because we're a work-at-will state. This is extremely concerning. And the reason why this legislation is coming out now is because what if this does happen again? You know, every time we get up here, we hear, what's the problem? Is there a problem? Are we actually, you know, addressing some sort of problem? Well, the problem already came and went. And now we've got new studies coming up saying that this likely is not safe at all. And now we have absolutely no protections for anybody who decides not to get one. They either have to find a new job if somebody says that, hey, you know, you need to put something in your body to work for me or to work for this company. It's just beyond me. But with all due respect, please do pass 1163, and appreciate your time.
Thank you, and I'm sure you'll stand by for some questions. We'll move to committee questions. Committee questions. All right, Representative Baxter.
Thank you. Question for the Prime. So how would it protect an immunocompromised individual that was working with a vaccinated individual? Since the COVID vaccine, there's numerous studies showing that it doesn't prevent transmission. So I know it was brought up about the immunocompromised, so I was just going to ask you about that.
Mr. Chair, Representative Bandera, District 10. That is also a little bit of a hypothetical. I mean, like we still need a little bit more information coming out about that, because what we are hearing is that it does not effectively reduce transmission at all. But if, for example, if you have an employer that says that we have somebody who's immunocompromised, what did we do during the time of, like, for example, COVID? You had to wear a mask, PPE. That's all part of this bill. So there have to be other alternate solutions that a business can provide someone who is an employee, remote work, whatever it may be. And I know Sanford was great with that, you know, when they were going through it. So they were wonderful. They had all of their systems set up. So that's just something that employers should be looking at. Does that answer your question?
Yep, thank you.
Thank you. Further committee questions for Representative Shapepower.
For the Prime, please. So in section, I wrote this down. Section 4, line 14, this pertains to students, and it says, base any loss of student status, including status in particular course or program of study. Would this also include students that are on athletic scholarships or their participation in athletics, and if their refusal to get these mandated shots, does that include that with status, or do we need to define that?
I did check with LRC on that, and that would include. So that means that if perhaps they were required to get one for participation in school sports, it could be argued that yes, they would be required. Yes. Mm-hmm.
Okay. Further questions on House Bill 1163? Further questions?
Mr.
Okay, Representative Baxter, do you know who you're asking?
The Sanford lobbyist, I think.
Allie, okay.
Oh, actually, no, not that one, sorry. The one next to Tim Rave, sorry. Yes, sorry.
Yeah, that's him.
No, the lady in the black.
Oh, that's Kim.
Kim, I'm sorry. My bad.
Avera.
My bad.
Rising.
Just a quick question. I know you mentioned that there's no studies that had been done, but I noticed that there was a Cleveland Clinic study that showed that individuals who got multiple COVID shots were up to 3 times more likely to contract a COVID infection. I was just curious on your comments about that.
Mr. Chair.
Go ahead.
Representative Baxter, I'm not aware of the study that you're referencing, but I think the fact that we still have COVID vaccines that are FDA approved based on scientific studies of safety profiles, the evidence is clear that COVID vaccines are safe and that the benefit that they provide outweighs any risks, adverse effects of those vaccines. This bill has to do with mRNA vaccines specifically, and of course there are other types of vaccines for COVID. which does get into that choice matter as well. And so during the COVID pandemic, when there was requirements, which there are not now, for employees to get vaccinated for the reasons that you've heard, employees always had that choice to choose an mRNA or a non-mRNA COVID vaccine, and that's what this bill has to do with.
All right, just I know we sorted out in the room who you were, but for those online, could you
I apologize. Kim Elson-Reisen with Avera Health.
Thank you. I believe Representative Garcia had a question first. Thanks.
Thank you, Mr. Chair. And I'm not sure this is for the opponents. Who is speaking to the pharmacy chemicals of the actual shot? Who can answer that? I don't know if it's going to be who it will be. Is it the Pharmacy Association? Can you speak to it, sir? Or no? I have a question. Okay,
Maybe
here's
state
my
your question and we'll.
Could you please tell me if you can, what is the N1 methylpseudouridine element in the COVID shot or the messenger RNA vaccinations?
Can you help us understand what that has to do?
Yeah, it's one
with
of the ingredients of the 7 that are in the messenger RNA, and I'd like them to tell me what that ingredient is, what it does, because it answers a lot of the questions that are here. So no one can answer that.
I think you might want to expound upon that during comment, maybe.
Okay, well, if no one can answer
That's
it.
okay.
Yep.
All right.
Mr. Chair. Mr. Chair.
Yeah, I have a question with Representative Rayfeld first.
Thank you, Mr. Chair. I have a question for the sponsor with Section 4. How would this influence individuals that are in healthcare programs that have contracts with healthcare facilities and affiliation agreements for their clinical experiences?
Representative Andera, District 10, they would have to be provided alternative options, PPE, all of that.
Mr. Chair? Are you aware that the schools don't determine that? It's the hospital facilities, and that's how affiliation agreements are written?
Yes.
Okay. Thank you. Representative Emery.
I guess I'll pose this to Tim Rave. Good morning. So, can you describe to me, like in any real-world situation, where removing vaccinations could pose a risk for vulnerable patients in either a nursing facility or a nursing home facility or rural hospitals here?
Mr. Chair, thank you for the question, Representative. Appreciate that. You know, I'll just go back to my opening remarks. I did talk about the employees. Employees have options. They have medical and religious exemptions, and they use them liberally in this state. To answer your question directly, Representative, let's just use the NICU example. You know, we act like hospitals and providers don't know anything anymore because of COVID, which was 6 years ago. But we're okay to risk the life of a baby in the NICU when we know that vaccinations, I understand the transmittal, blah, 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 I understand all that. What we're talking about here is not getting sick in the first place. And then you don't make those kids sick. And you get a NICU baby sick, bad things happen. They're probably our most vulnerable population besides the elderly in the long-term care facilities. So there's a balance between the employees who have rights today and patients. And we need to find that balance and stick to it. Thank you, Mr. Chair, and thank you for the question, Representative.
Thank you. Representative Heineman.
Thank you. For the Rapid City representative, do you know?
Yeah, Alan Solano.
No, the other guy.
Oh.
I'm sorry, I don't know
Elevate
his
Rapid
name.
City.
Elevate Rapid City.
He left the room.
Okay. Okay.
Okay.
All right. I guess I'll pose my question and somebody can come up if they'd like. To my knowledge, there are no genetic-based vaccines other than the COVID that are presently being used for immunizations in our country. And I want to know why. There are developed ones, but none are being used.
Mr. Chair, Justin Smith, Infectious Disease Prevention Network, Greater Sioux Falls Area Chamber of Commerce. Representative Heineman, I'll try to answer your question to the best of my ability. I'm not a medical practitioner, not a scientist, but every vaccine must go through an extremely strict testing process in the medical community with all the medical testing and R&D that goes into those vaccines. And it also must then go through the FDA approval process, and they screen it very carefully. mRNA vaccines are literally the cutting edge of vaccine technology. And you are correct that, to my knowledge, the COVID vaccine is the one, perhaps the only, that's currently in use. Now, again, as a lot of the opponents testified on the bill, this bill locks it down. So even if the technology continues to improve, even if additional diseases are going to use mRNA-based technology in the future, regardless of a future outbreak, which we can't predict right now, this would forever lock it down. So if the technology changes and all vaccines, or the biggest vaccines, start to be mRNA-based, this locks that down. But to the point, I don't think it's because they're unsafe. It's just because either they haven't made it through the FDA approval process, or there's not an outbreak or a huge need for those right now.
Thank you. I'm going to ask the final question, if that's okay. Mr. Rave, please. You kind of referred to it just here a little bit ago, but you also stated something about just South Dakota's exemption rates based on what's already in place. Can you just reiterate for me one more time? You said a statistic of we have something close to 7%, maybe 6.8, higher than Minnesota. Are there other states that we're higher than as well that have similar laws than maybe what's being proposed here at 1163?
Yeah, Mr. Chair, thanks for the question. Don't quote me on that. It's 6.8772. I don't remember where it's at. If you look at some of the highest ones in the country, you have Idaho at 15% exemption rate, but you have, California, Connecticut down at 0.01. Really, the top five, I think, are interesting. Idaho at 15, Utah at 10, Oregon at 10, Alaska at 9, Arizona at 9, and then you have several on the bottom end. So I would say we're somewhere in the middle, frankly, almost exactly in the middle of states around us. I know Minnesota's a little higher. Some of these obviously are a little lower. So,
okay, thank you for that. All right, with that, we'll close committee questions and move to action and/or discussion. Representative Schaefer.
Thank you, Mr. Chair. I move to pass.
We have a do pass motion on House Bill 1163 by Representative Schaefer, a second by Representative Jordan. Comments on that motion?
Thank you, Mr. Chair. I have quite a few comments. Just a simple Google search, and you can find numerous lawsuits from employees to their employers. Just some sample ones: 10.3 million lawsuit over employer mandate, $10.3 million lawsuit over an employer mandate. Employees won. Mayo Clinic sued over mandate for violating somebody's religious conviction because they didn't want the shot. Students forced to get shots to participate in sports and finish school, finish clinicals to save their placement. Colorado school was sued for $10 million, and the students won. Washington state agencies, these are state agencies that sued the state and won for their employees. Hotels were sued. Wrongful termination lawsuits by city workers in New York City. They sued the city and they won. Here's a little number for you: 24,520 total number of COVID-19 labor-related lawsuits in the United States. 2,700 of them as of August of 23. I mean, that's 3 years ago almost. They were all employees suing their employers over this mandate. And I think one of the kind of most ironic things about this whole this mandate is, the line "my body, my choice." Boy, was that never adhered to. When I don't want to put something in my body, it should be my choice. And in order to keep my job, That's, I think, just a step too far. Yes, there were many employers in this state that did not mandate their their employees to get this shot. Do you know why? They didn't want to get sued. Unless they had specific stipulations from Medicare and Medicaid, they did not mandate this vaccination because they did not want to get sued. And yes, it's been 6 years since this atrocity was forced upon the world, and a lot has been learned, and I think this is the tip of the iceberg that is showing. So I think, yes, we are a right to work state. Employers can sue at any time if they don't like your hair color. But I'm thinking, because this is something that absolutely, there's no way to get this out of your body. I don't care what study somebody says is out there that this is safe. There is no way to get this out of your body. I commend the employers that did not force this upon their employees, and they didn't want to get sued, and I'm afraid the lawsuits are only starting. So thank you.
All right, thank you. Representative Garcia.
Before just moving forward with the what you're moving, I'd just like to make a comment on a few discrepancies in the narrative that's being portrayed. So that N1 methylpseudovirine is actually in the Moderna and the Pfizer. And I wanted to know if they actually knew when they were speaking to it what that actually does. And that increases the cancer cells. And that is hence why we now know, as of 2024, why we're getting these turbo cancers. That's my first point. The other question was, someone asked on the panel, what other vaccines have messenger RNA? Well, that would include your flu vaccine and your RSV vaccine, which also have messenger RNA in it. So it's not just the COVID. And then I go to the VAERS report, which I think everyone should be familiar with that report and how many deaths we've had since this whole thing of messenger RNA has come out. And there's tremendous amount, over 39,000, if not more. The increasing of myocarditis, which now we know correlates to the COVID-19 jab, which is messenger RNA. And the last but not least, is that the most vaccines don't prevent transmission because the diseases are transmissible. Your Tdap, your Hib, your Hep A. So I think that when we're having these discussions, especially in this critical committee, we need to have the facts and not hypotheticals. And I'm always going to go back to the facts. These studies, by the way, they're since 2024, 2025, 2026. They're current, they're out there, and there's a plethora of them. So I just want to make that comment. Thank you, Mr. Chair, because I did not have the opportunity.
Thank you. Further comments on House Bill 1163? Sure. Go ahead, Representative Rayfeld.
Well, I do think that this committee has a responsibility to go off of facts and science, and to claim from one representative that the facts and science that you're saying is the only science and facts is misleading. There are all kinds of study that talks about the efficacy and the good parts of the mRNA vaccines, and to insinuate that that is not true is a disservice to our state. I will talk about Section 4 of this bill. Section 4 is very problematic. From my experience as an educator, I worked at Mount Marty University for many years, and my responsibility was along the clinical lines. I was in charge of all of the residencies for our students. And from an informational standpoint, affiliation agreements between a school and a hospital for the clinical experiences is based on what the hospital says the institution must abide by. So this bill says that a student would not be able to change their institutional status as a student if they did not, or if they were required to get the vaccination. That vaccination could be required in another state, it could be required in this state, it could be required as part of their clinical experience, and that is the only place that that student could complete that residency. And so you're forcing a school to keep students that they can't get the experiences that they need in order to graduate, which adds cost to the institutions, adds cost, frankly, to our state, and isn't practical. So Section 4 to me is just not workable at all. I wouldn't like this bill regardless, but that is really problematic.
Thank you. Representative Heineman.
Thank you, Mr. Chair. Well, it's interesting to see that who comes to the table in the discussions, especially, I guess, the opponents indicating that you can take your business elsewhere. You don't have to stay here if you don't like our rules and regulations. But then, we have other bills that we're dealing with, giving tax credits away to large entities, and those same people are lining up on that side and saying we need to make these changes in our state because otherwise we're not business friendly. That was an observation that I have to kind of shout out there. My issue with the genetic-based vaccines, first of all, I was told by the veterinary system that about 60% of their vaccines are mRNA in the vet system world. And so I was having this discussion with this veterinary, and there are also other approved mRNA vaccines. Very limited, that's true. Most of them are in the phase 3 trial. I would agree with that. But there are some that are available, and they're not used. They're not used, not readily available, and they're not promoted. So that really makes me wonder why the medical community is not doing that. I can make an analogy. I could go on and on. I'll make it short. But the analogy of genetically modified wheat. Well, they have that, but it's not used, and that's because of the concern for the food supply. I get that, but I think the medical community is not listening. That I promoted that before, and I'll agree here again. They're not listening because patients have concerns, they have choices, they want choices, they don't want to be tied down to a vaccine. I think we need to listen to them, and I think this is an opportunity to listen, to have them open their eyes and say, we're hearing you. So I'm going to support the motion. Thank you.
Thank you, Representative Baxter.
Thank you, Mr. Chair. While we're talking about science, I went onto the CDC underneath their vaccine adverse event reporting system, which was put into place in 1990, and it accounts for about 1% of vaccine injuries. And as of last month, it shows almost 39,000 deaths to the COVID vaccine, as well as over 22,000 heart attacks, almost 30,000 cases of myocarditis, and over 74,000 people permanently disabled, and that's just the tip of the iceberg of their reporting from the CDC. So, thank you.
All right, thank you. Representative Jordan.
Thank you, Mr. Chair. I remember being a delivery driver during COVID for FedEx, and I delivered to a couple nursing homes and a couple medical facilities, and you had to go into the back room to deliver it. And I seen the signs written for their employees by these medical establishments and nursing homes, and it was ridiculous, uncalled for, and evil what they put all these staff members through. So anything I can do to help with that, I'm going to do. Also, if all these vaccines are so effective.
Point of order. What does this have to do with this?
All right, if you could wrap up.
If these vaccines or jabs are so effective, there's no point in making them mandatory. So anything I can do to help support that, I'm going to do it. So please vote yes.
Okay. With that, we're going to close discussion, and what we have before us is a due pass motion of House Bill 1163, moved by Representative Schaefbauer, seconded by Representative Jordan. All those in favor of that motion will say aye. Those opposed to that motion will say nay. Madam Secretary, please call the roll.
Representative Rayfeld.
No.
Bosnus.
No.
Halverson.
No.
Jordan.
Aye.
Garcia.
Aye.
Emery.
No.
Andera.
Aye.
Kaiser.
Aye.
Schaefbauer.
Aye.
Manhart.
Aye.
Baxter.
Aye.
Heineman.
Aye.
Mulder.
No.
8 ayes, 5 nays.
Having received the majority vote of members-elect, House Bill 1163 will move to the floor with a due pass motion. All right, House Bill 1210, prohibit COVID vaccination requirements and provide a penalty therefore. Representative Garcia will set it at 12 minutes.
Thank you, Mr. Chair. Everyone take a deep breath. It's not as bad as it sounds. But thank you, Mr. Chair. Representative Garcia, District 5. Good morning, Mr. Chair, committee, and the public, and those listening online. House Bill 1210 codifies protection beyond current executive orders. Currently, COVID-19 vaccine requirements are limited by executive orders, which could be changed by future governors. This bill protects employees and students by not requiring a COVID-19 vaccine to keep a job in the state agency or private organization, attend a university, or receive government or private services. People who have medical, religious, or personal objections would be legally protected from mandates. House Bill 1210 reduces the ambiguity about what entities can legally demand from individuals. It also has a strong deterrent against organizations imposing vaccine requirements, giving people legal recourse if a mandate is ever attempted. House Bill 1210 would prevent vaccine passports for services or benefits. House Bill 1210 does not change federal requirements. It would not override federal mandates. Hospitals and medical providers may still recommend vaccines but cannot mandate. House Bill 1210 would permanently restrict government entities from requiring COVID-19 vaccinations, including for services, licenses, and benefits. This bill would establish a precedent for managing mandates in future emergencies. House Bill 1210 protects individual rights, autonomy, and provides long-term certainty. In short, House Bill 1210 would strengthen, broaden, and make permanent the protections offered by our current executive orders. Thank you. I'll stand by for questions.
Thank you, Mr. Chair. I'm John Coonery from District 11, Sioux Falls, and I'm just passing out a picture, and this is to put it into context, how personal this subject is to me and to millions of other people like me around the country and around the world. And I'm just going to give you a little bit of background, so please bear with me. As I said, my name is John Coonery. I'm here to testify in person today because I have firsthand experience of the serious injuries and permanent consequences of the mRNA injections that people in America and around the world were coerced into 5 years ago. And to give you context, I want you to know that my mother was a nurse anesthetist also. And it's too bad that that representative walked out. She enlisted in World War II, and so she was a very brave woman, and she went with her Army hospital across the North Atlantic in the winter leading up to June 1944, and she was in England in 1944, and they took casualties off of Normandy beaches. That was my brave mother, and my father also. You see pictures of. His name was Carl Raymond Coonery, and he was an officer aboard ships that went across the North Atlantic during the worst storms, and they were hunted by enemy submarine wolf packs, and he survived that. And both my mother and father lived good lives, and they were good parents to us. My father survived those treacherous times. However, he did not survive Big Pharma, Big Med, and our federal agencies that pushed the dangerous mRNA injections in 2021. I talked with him the day after he was given the first mRNA injection in January of 2021. He, until that time, had been in very good health. He was very sharp. But he told me the next day when I talked to him on the phone, he says, something is wrong with what they gave me, the injection. I don't feel right afterwards. And over the next month and a half, it seemed he was starting to feel a little better. But then in early March 2021, after the person who had the authority over medical directives and coercion from the care center that he was in, he had the second injection. and he went down rapidly. And our family had to plan and conduct my dad's funeral approximately a week later. I personally know 2 other wonderful ladies. Personally, a similar scenario happened. I won't go into those. These so-called MNR synthetic gene therapies were untested for safety and pushed out using propaganda and fear. They never should have been allowed to be used. Such dangerous concoctions should never be allowed to be forced upon anyone ever again, in my opinion. And so I ask you, please, vote yes on this bill, HB 1210. Thank you.
Thank you for your story. Further proponent testimony for House Bill 1210. Further proponent testimony. Seeing none in the room, or Jennifer Foss online, proponent testimony. Ms. Foss?
I'm here. Can you hear me?
Yes, but it looks like
Okay.
you have 2 up and we're kind of getting a echo return.
Okay. Thank you, Chairman Mulder and committee members. I am getting an echo. Are you? No?
We're getting a little bit of an echo, but must be on your end. It looks like you have 2 squares up for. We're good now.
Oh,
Okay, go ahead.
Okay. Gotcha. Is that better?
Go ahead. Just continue.
Okay. Thank you. I'm Jennifer Foss, District 9, Sioux Falls, representing myself, and I am not a lobbyist. I come to you today as a healthcare professional, someone that lost a parent and whose child was affected by the COVID-19 pandemic. Then also as a resident of South Dakota who believes in medical freedom. I will just hit a few highlights to keep my testimony short. As a healthcare professional, I don't need to say really anything more than Dr. Garcia has offered. I will add a me too. I will just say that the mRNA does affect DNA because it causes it to create those spike proteins. And the mRNA founder, Dr. Malone, also has concerns. As a natural healthcare provider, I have heard countless stories of what this did to the health and well-being of my patients and the people they love. Many stories of losing loved ones to turbo cancer, blood clots, heart issues, miscarriages, depression and anxiety. And I have seen firsthand the effects of COVID shot, not anecdotally, on my patients, ranging from diminished immune systems, depression, anaphylaxis, and just poor health outcomes directly from the shot. In particular, that spike protein wipes out the natural defenses, which leads to an increase in other illnesses. People just reported being sicker. In my own family, I saw my once active parents decline rapidly after the COVID shots, going from extremely active retired people to not being able to walk across the room. My mom died following an accident related to this decline. I don't think that you have the same personality for 70 plus years and then just lose all motivation and zest for life. My daughter was also affected by this as someone who graduated in 2020, and she experienced her own issues related to the vaccine after being essentially emotionally blackmailed at USD to take that shot. I saw her health also change completely in just a few short months. These are real people that I love. I chose not to take the vaccine and I have no regrets, but I am also grateful I wasn't forced to do so. In conclusion, I will remind you that you all took an oath to the Constitution and you promised to uphold it. The 14th Amendment states that we are to have medical freedom, and the fact that people can be forced into vaccination completely violates their rights. I knew many who were forced to take the COVID vaccine by their employers, the military, the schools, and the government. Some of those people had their own consequences and had no say in it. Many people moved here because of the freedom South Dakota offered. We are no longer in that emergency clause that these mandates were originally formed under. There are other options now, and people should have that choice. The U.S. Department of Health says that we are no longer to have mandates. And the BARDA Commission says that we are not going to be spending that kind of money and have those research projects for a reason for these mRNA vaccines. This has real life complications for people's lives. I ask for a due pass on HB 1210 and thank you for your time and sorry for the echo.
Thank you. We have about 1 minute left. Brian Hooker, you are signed up for proponent testimony for House Bill 1216. Go ahead. For 1 minute.
Yes, sir. I'll go as quickly as possible. I am in favor of House Bill 1210. My name is Dr. Brian Hooker. I'm a PhD scientist and the Chief Scientific Officer of Children's Health Defense, and also represent the South Dakota chapter of Children's Health Defense. I'm not a resident of South Dakota. The COVID-19 shot is primarily an experimentally modified mRNA technology that is more than more of a genetic therapy than a vaccine. The vast majority of the shots distributed in the United States, over 95%, employ this technology. Typically, genetic therapies undergo up to 10 years of testing prior to FDA approval. Due to the untested nature of these products in terms of carcinogenicity, teratogenicity, as well as a potential for birth defects for those individuals receiving this vaccine either prenatally or preconception. The Pfizer and Moderna shots, however, went through only months of human trials with less than 3 months of human trial data where the shots were compared against a true saline placebo. The Pfizer and Moderna claimed that these shots would stay in the upper deltoid muscle for a mere 2 weeks and then degrade naturally, would not replicate or reverse transcribe, would not allow for transient production of the COVID spike protein beyond this 2 week period. And within the 5 years of post-market surveillance data, we know that none of these claims are true. Individuals that receive these shots, some of them are actively producing spike protein in all parts of their body for over 2 years following receipt of the shot. Also, the spike protein and lipid nanoparticles have been detected in virtually all major internal organs, including the fetal side of the placenta in pregnant women. These shots are contaminated at DNA levels that are over 40 times higher than the FDA acceptable limit of 10 nanograms per shot. And DNA fragments include the genetic code for the spike protein, as well as for the SV40 promoter and cis-acting elements that have the capability to promote cancer formations. The Pfizer and Moderna shots in hindsight should have never been granted emergency use authorization by the FDA, and of course should have never been fully FDA approved. In real numbers, modified mRNA COVID shots have killed at least an estimated 17 million individuals worldwide, with at least 500,000 of these individuals in the United States. They've definitively been linked to the onset of myocarditis, especially in young adult men, where as many as 2 in 100 men are afflicted. With this risk profile and essentially no demonstrable benefit.
Dr. Hooker, we've really exceeded our time limits here.
Okay.
With that,
I
so
do
if you just have a
apologize.
final statement.
Thank you very much.
So, and I see that we have a Dr. Brian Ardis. We don't have you registered, and we're not sure, but if, again, we've exceeded our time limits. If you would just identify yourself, state who you're with, maybe associate your remarks with the previous comments or me too, that would be wonderful. Thank you.
Yeah,
and then
great.
we need to
Dr.
get you
Brian.
registered as a proponent.
Yeah. I was asked to join this by Heather Baxter. I support Brian Hooker's statements there. I'm pro this bill 1210. And I am, so let me just quote here for you here. All of you out there who are in favor at all of the COVID-19 vaccines, that is the Spike Vax, that is the Comirnaty, I would like to just quote to you from their package inserts, all of those who actually have obviously never read them. Section 5.4 and 5.5 of all 3 of the mRNA COVID-19 vaccines read this way. Comirnaty may not protect all vaccine recipients. This is each one of them. Spikevax may not protect all vaccine recipients. Those who are immunocompromised, this may not provide any benefit. That's section 5.4. For all of you out there, 5.2 in the package inserts of each of the COVID-19 mRNA vaccines reads, all three of them, quote, have demonstrated increased risk of myocarditis and pericarditis with onsets of symptoms, typically in the first week following the vaccination. This is FDA.gov's published package inserts for each of the COVID-19 vaccines. There have been multiple people who've testified here. I've listened to them say there are no research studies showing a link to any kind of side effects, deaths related to COVID-19 vaccines. I will just quote one. The Journal of Emergency Medicine, the title of the article, Excess Cardiopulmonary Arrest and Mortality After COVID-19 Vaccine in King County, Washington alone. 98% of the county received the vaccines. There was a 1,236% increase of fatal cardiopulmonary arrests.
Thank you, Doctor. Again, we've exceeded our time. Could you state one more time your name, who you're representing, and then we'll have to get you registered and where you're from.
I am Dr. Brian Artis. The increase of excess mortality rate is 20% with myocarditis.
Who are you representing and where are you from? Thank you.
Oh, I am from Dallas, Texas, representing the people of South Dakota.
Okay, thank you. With that, we will move to opponent testimony for House Bill 1210. And we'll set the clock at 12 minutes.
Good morning, Mr. Chair. My name is Dan Heineman. I'm speaking as a board-certified family physician and a member of District 10. I'm also a medical director at 2 long-term care facilities and was a medical director of a facility that in 2020 lost 25 of the 40 residents because of COVID-19, at that time, infections before the vaccine was available. Since then, we've not lost any that I can recall residents in any of the facilities that I'm in, and we have about a 95% vaccination rate for COVID vaccine in our facilities. This bill would not allow me and our leadership team to impress upon the staff how important it is to protect the vulnerable in our facilities. With both influenza, we have about a 98% influenza vaccination rate, and we're at about a 95% COVID vaccination rate in our 2 facilities that I represent. There's lots of things that have been said today that have been attributed to the COVID vaccine. I'm not going to sit here and argue with everybody's philosophy and beliefs, but I don't believe that the science necessarily stands true on all of those claims. There have been things that have been identified as we've gone along and understand this better. Remember where we were in 2020. We were scared. We had a worldwide pandemic. We didn't know what we were going to be able to do. We were trying and grasping at straws. We were trying every known medication that might, in a test tube, kill this virus. And our president at the time put a lot of money into the development of vaccines, and they ended up being mRNA vaccines. And just this week, Moderna submitted to the FDA an mRNA flu vaccine that might be the flu vaccine of the future, because it won't matter what strain you have in terms of influenza. This will be a universal vaccine. And you may only have to get that shot every so often instead of annually. So I'm not here to argue philosophy or try to convert people's minds. I just am telling you, this does not protect the vulnerable in my facilities when I've been able to convince the staff at our facilities the efficacy and the importance of getting vaccinated. I'm not registered yet. I will get registered after I testify. Thank you.
Thank you. Further opponent testimony for House Bill 1210. About 9 minutes left.
Yep, thank you, Mr. Chair. I'll be brief. Tim Rave, representing Sadaho, from South Dakota, representing South Dakota hospitals and providers. I would just associate myself with my previous remarks, my previous testimony, so we're not going to waste time. Again, healthcare, the healthcare industry has taken a little beating, and I would say that my remarks would be this. The healthcare industry bases the things they do on science, not things we Google or on a Facebook page or a chat or whatever it is. And I understand that doesn't always align with, as the previous speaker said, people's personal beliefs or thoughts. But everything we do is to protect patients. And that's the one group that we don't talk about today. We talk about employee rights. I can only say it one more time, which is probably the fourth time. Employees have rights to not get these vaccinations. Employers, in fact, today aren't mandating this vaccination. And I don't know. I would just ask you to oppose the bill. I think I'll stand by for questions. Thank you.
Thank you. Further opposition to House Bill 1210.
Good morning, Mr. Chairman. Again, members of the committee. Justin Smith, attorney from Sioux Falls, registered lobbyist for the Greater Sioux Falls Chamber of Commerce. We speak for hundreds of large and small businesses in our state, which consistently resist bills like HB 1210, which infringe on private industry control over its own affairs. I continue this bill, the discussion on this bill, the discussion on the last bill are creating a confusing question here. Is this bill a referendum on the COVID vaccine? Or is it, getting us back to the actual language of this bill, a prohibition on private businesses and private industry? Many other states right now are considering bills to outright ban the COVID vaccine, to outright ban mRNA vaccines. That's not this bill, and that's not the last bill. This bill is going after our small businesses, our healthcare industries in South Dakota. Plain and simple. It is an infringement on private industry. No one in South Dakota is forced to get the COVID vaccine today. Where are the South Dakotans who were fired for refusing to get the COVID vaccine? Where are the South Dakotans who were forced to get a vaccine against their wishes? For 5 years, bills like this one have come forward. We have never seen a South Dakotan sit down in this chair and say, I was fired because I refused to get X vaccine. They're certainly not on the call today. The pandemic came and went, and we are not hearing today about actual examples in this state, only in some other states. Thousands of lawsuits, millions in damages. None of them happened here in South Dakota because we handle our own affairs by the free market and by trusting local control and healthcare professionals who are licensed in this state. The retailers made it clear this immunocompromised issue is not a hypothetical in South Dakota. These situations actually happened here, unlike employees being fired or students being expelled or providers being deboarded. Those things didn't happen in South Dakota. Are your constituents asking you to pass this bill? Are they citing to you specific examples of when they were fired? This bill doesn't have any exceptions, unlike the last bill. It's going to apply to all the healthcare providers, to all businesses, to all health students, to students in general. The Sioux Falls Chamber opposes business mandates, even though I'm unaware of any businesses which still require the COVID vaccine for their employees. At the end of the day, members of the committee, this bill is going to impose criminal penalties on your local businesses if they have one of these policies for reasons that may be important to their business. Class 2 misdemeanor. You're going to criminalize your local businesses, your Main Street businesses in your communities. Law enforcement expense, I could make a dozen other arguments up here, but I just wanted to sit down and say, if this bill was necessary, we would be hearing from South Dakotans crying for this to actually happen because their rights were violated. I'll stand by for questions. Thank you.
Thank you. Further opponent testimony. We got about 4 minutes, 30 seconds left.
Good morning, Mr. Chair, members of the committee. My name is Lindsay Ryder-Rapp, and I'm a registered lobbyist for the South Dakota Pharmacist Association. We also oppose this bill. I certainly don't want to retread the same ground. There's very extremely broad language, frankly, in this bill. But I would just state from the pharmacist perspective, we routinely serve elderly medically fragile and immunocompromised patients. These are not optional interactions. They are at the core of the pharmacy practice. Removing these vaccine requirements options strips those pharmacies of one of the very few proactive available measures it has to reduce disease transmission in patients and in these healthcare environments. And so we do have concerns with this bill. As some of the prior speakers have indicated, first and foremost is protection of our patients and those we serve. And we think that this measure would fly in the face of that. And so for those reasons, we do oppose it. Thank you.
Thank you. Further opponent testimony for House Bill 1210. 3 minutes left.
Mr. Chairman, members of the committee, my name is Justin Bell. I'm a registered lobbyist for the South Dakota State Medical Association. I associate my comments with the prior opponents and with the opponents of the last legislation. I only add one thing, and that's this. One is this does not necessarily limit itself to any specific type of vaccine. The prior bill, although broad in its language related to any mRNA or genetic-based vaccine, this says any COVID vaccine. It could be any COVID vaccine that's not even invented yet as it relates to it. It also doesn't recognize the fact, although almost all of the testimony was relating to mRNA vaccines, there's a non-mRNA vaccine available for COVID-19 as well. So, and there could be more in the future. But with that, the rest of my testimony would be duplicative of the prior opponents, and I would simply ask that you oppose this legislation. Thank you.
Thank you. Appreciate that. House Bill, or opponent testimony for House Bill 1210.
Good morning, Mr. Chair, members of the committee. Alan Solano, Monument Health, Rapid City. I would simply just associate my comments with the previous opponents and ask you to oppose House Bill 1210. Thank you.
Thank you. Further opponent testimony for House Bill 1210.
Good morning, Mr. Chair and members of the committee. Kim Elsom Ryson with Avera Health. I'm asking you to send House Bill 1210 to the 41st day for all the reasons that you already heard on this bill and the previous bill. I would just add one comment to the proponent testimony around executive orders. There were no executive orders in the state of South Dakota that required anybody to get a COVID vaccine. So there was no chance of that happening. It did not happen. In fact, the only executive order that dealt with COVID vaccine had to do with prohibiting vaccine passports that would require people to show their vaccination status. And within the body of that executive order, it clearly said that people had a choice of whether to get that vaccine or not. So this bill does not address those issues because they do not exist. Thank you.
Thank you. Further opponent testimony for 1210. But 1 minute left.
Good morning, Allie Dawes, Sanford Health. We respectfully ask for your opposition on 1210. Thanks.
Opponent testimony for House Bill 12.
Mr. Chairman, Brett Hoffman, South Dakota Healthcare Association. We represent nursing homes, assisted living, and other long-term care providers. We would also ask for your opposition to this bill and reiterate that the COVID vaccine is not a condition for employment in long-term care facilities in South Dakota. Thank you.
Thank you. Further opponent testimony for House Bill 1210.
Good morning, Mr. Chair, members of the committee. I'm Terry Dosh. I'm with South Dakota Council of Community Behavioral Health. I think it's all been said. And we agree and associate ourselves with the other opponents. So me too.
Thank you. Further opponent testimony in the room for House Bill 1210.
Mr. Chair, members of the committee, Garth Wadsworth with Elevate Rapid City. I think it's worth emphasizing this creates a crime out of what is an otherwise mundane, I'd say boring HR policy. We don't need this mandate from the state. Thanks for your opposition.
Thank you. Seeing no further opponent testimony in the room, I believe we might have one online. And again, Carmen, we're in the same situation as we were before in the Me Too portion. If you want to go ahead and make a quick statement, who you are,
Thank
who
you,
you represent. Thank you.
Thank you, Mr. Chair. Carmen Toft with American Families for Vaccine, the Action Fund, and South Dakota Families for Vaccines. I am a resident of South Dakota and District 10 in Sioux Falls. I echo the sentiments of the other opponents and encourage you to oppose House Bill 1210.
Thank you, Ms. Toft. With that, we will close opposition testimony and move to rebuttal. Representative Garcia.
Thank you, Mr. Chair, committee, and all those. I really appreciate all the opponents and proponents' testimony as this conversation needs to be had. Just to clarify a few points, House Bill 1210 codifies protection. That's simply what it does. The executive orders, that was incorrectly stated previously by an opponent. There are two. The governor has not disbanded them. If you look it up, he still has them in effect. So what this bill actually does is make sure that people have the security and the rights, and they provide the long-term certainty that that can never happen. So that's what the bill does. As I sit here today, I don't know. It's really, I don't know what to say. Is it appalling? Is it ignorance? Or in denial? The fact that there's studies that we know what's happened, that no employer or any person has come here to testify, well, it is what time? 7:30, 8:30 in the morning, and we are here. How about retaliation that happens when people stand up? How about the lack of trust that they get with representation? How about they just don't want to lose their jobs? So I think that it is important to understand that this bill, what it does do is it allows protection, individual protection of rights, autonomy, and again, I will state, provides long-term certainty. It would strengthen, broaden, and make permanent the protections offered. And that is what the people of South Dakota put me here to do, and that is why I'm here asking you for a do pass. Thank you.
Thank you. We'll move to committee questions. Committee questions. Seeing no committee questions, we'll move to action and/or discussion. Action and/or discussion. Representative Schaefer.
I move do pass.
Second. We have a do pass motion by Representative Schaefer, a second by, somebody said it over here first, Representative Indira. For House Bill 1210, comments on that motion, Representative Schaefer.
Yes, I do. Thank you. First of all, to answer Mr. Smith's question on where are the people who are mandated to get these shots, well, right now they are professionals working in the state of South Dakota. I am their mother. One was a student who was mandated to get this shot in order for him to finish his degree. The other was a student that refused to get it, even though he was mandated at one of our universities here. He did not get to participate in his college sport the way he would have if he received the shot. He had to go above and beyond extra qualifications in order to participate in that sport of his choice, and actually of his scholarship. I was an employer who refused to do a mandate because, one, I didn't want to get sued, and two, because I didn't want to take away the choice of my employees. And my company is long-term care facilities. That has nothing to do with the residents of the long-term care facilities. That has to do with the employees. We gave exemptions if they believed in pixie dust. Anything to not get possibly sued in the future when all of this explodes. You know, why do we keep talking about COVID? Why do we keep talking about these shots and how bad they are and what we are learning on a daily basis? Is because it was the absolute tipping point in our world's history of utter compliance, fear, and major health concerns that we haven't even got to the tip of. Wait for the prion tissue. That's going to be our next thing. You know, this bill, it gives a clear, concise, which way do we go? What are our options here in South Dakota? COVID completely changed how we did things in the world. Many, many, many people made tons of money. Many people lost their businesses, lost their jobs. People's lives were ruined with health issues. Like I said, we don't even know the effects. I think this bill, since now we can live and we learn, and that's what we're supposed to do. Learn from our past. And this bill will help us move in the right direction. So I thank Representative Garcia for bringing this.
Further comments on House Bill 1210? Representative Emery.
Thank you, Mr. Chair. So, I mean, I've sitting here listening to all three of these bills this morning, and I think the thing that really resonates in my mind is the fact that we keep trying to villainize our healthcare system here in South Dakota. As being somebody who was at the front lines of COVID-19, did not get the isolation and have to stay home, and who worked every single day during COVID-19, tirelessly away from my family, and seeing the effects of what COVID-19 did to the people. Whether we were vaccinated or not, that's your choice. I don't really care. You know, you can be vaccinated, you can be non-vaccinated. That's up to you. That's free will. I don't really care what you do with your body. So be it. What I don't like is how this committee keeps villainizing our healthcare system here in South Dakota. Our three big healthcare systems are here. They'll serve you. If you're dying today, you're going to end up in one of them, and they will do their best to take care of you. So it's just disheartening how we sit here and we want to villainize the healthcare system here in South Dakota time and time again, and we've done it all session long. And it just irritates me that we sit here and we do this, and we feel that it's just okay to do. And I hope at one time that you're going to need somebody in the healthcare system here in South Dakota, and they take care of you, because regardless of what your personal beliefs are. Thank you.
Further discussion on House Bill. Representative Fosness.
Thank you, Mr. Chair. I have to echo what you just said too. I can't say thank you for today, for the last couple hours listening on the front lines. I was a school board president at the time and a hospital CEO, working with a great team 24/7 on phone calls 7 days a week, multiple systems trying to work and address something that we had no idea what was coming. But it was scary, scarier beyond FedEx deliveries. Scary because we were there, scary because we're supplying people with jobs that we kept them working in. We increased our employment as our patients increased. What we're talking about today is just, we're so beyond that in healthcare. Actually, we're beyond this. This is 5 years ago. We're dealing with influenza A, B, adult RSV right now that's in our facilities that's going around. The COVID is treated in the clinic. And so, but here we are today talking about this. I'm going to be a no, but it's very obvious this, like the last bill, will get right out of this committee, and we'll do it. We'll go through the motions. We'll have discussions on the floor again. But I'm going to stand with the lineup of opponents with a no vote today for every right reason, and protecting the health care of our South Dakotans that we did a great job of in this state, and we should be proud of that. Thank you.
Further comments on House Bill 1210? Seeing none, what we have before us is a do-pass motion made by Representative Schaefbauer, seconded by Representative Andera, to send House Bill 1210 to the floor with a do-pass recommendation. All those in favor will say aye. All those opposed will say nay. Madam Secretary, please call the roll.
Representative Rayfelt.
No.
Fosness.
No.
Halverson.
No.
Jordan.
Aye.
Garcia. Emery.
No.
Andera.
Aye.
Kaiser.
Aye.
Schaefbauer.
Aye.
Manhart.
Aye.
Baxter.
Aye.
Heineman.
Aye.
Mulder.
No.
8-5.
Having received a majority vote of members of elect, House Bill 1210 will move to the floor with a do-pass recommendation. Again, thank you, committee, for getting through our heavy bill load. We do have Tuesday morning, we'll be taking on Senate bills. With that, I will entertain a motion to adjourn.
So moved.
Moved by Representative Emery, seconded by Representative Baxter. All those in favor of adjournment say aye. Aye. Opposed say nay. We are adjourned. Thank you, staff, for your work.
SDPB helps shape South Dakota's future by educating, informing, and inspiring the next generation of thinkers, leaders, and creators. SDPB. Good, useful, and full of wonder. SDPB serves South Dakota through an interconnected communication system that is on 24/7, 365. The first place for Amber Alerts, public safety announcements, and EAS messages. SDPB keeps public servants and citizens informed. Good, useful, and full of wonder. SDPB. SDPB brings you closer to your government. With gavel-to-gavel coverage of the South Dakota legislature and in-depth reporting from peer. Good, useful, and full of wonder. SDPB. From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB. When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB. Good, useful, and full of wonder.
Good morning and welcome to Senate Commerce and Energy. A reminder, I would ask everyone to please take a seat and have your phones turned to silent. If you plan on testifying today, please sign in at sdlegislature.gov. Press the people icon or link next to the agenda and fill out the form, or you can do this directly on your phone by scanning the QR code on the agenda above the podium. At this time, I'd ask the secretary to please call the roll.
Senators Melhoff,
Here.
Dibert,
Good morning.
Hone. Here. Carr, excused. Kobeck. Here. Larson. Here. Perry. Excused. Peterson. Excused. Crabtree.
Here.
Mr. Chair, we do have a quorum.
Thank you. At this time, the chair would entertain a motion to approve the minutes of our last meeting. Moved by Larson, seconded by Dibert. All those in favor, please say aye. All those opposed say no. Minutes are approved. Another reminder, testifiers, please make sure you are signed in at the back. If you don't know how to do it, see one of these fine folks in the yellow shirt. The pages will help you through that. And also make sure you have your badges clearly visible. If you have any handouts that you want distributed, please make sure that the pages do that for you. And at this time, I'd welcome the pages up. Why don't you tell us a little bit about where you're from, what your plans are next year, and your best clean joke. I'll let you use your discretion on what you think the clean joke is.
I'm Lee Decker. I'm a junior at Stevens High School. After I graduate, I plan on going to law school. And why was the bullet sad? Because he got fired.
Well done.
I'm Mr. Burkhalter. I'm a senior, and I'm from Prairie City, or Struhl. And I'm not going to say a joke today, so thank you.
All right. All right. Well, the other one was good enough, right? It covered both of them. So thank you guys. Appreciate all your work here today. Just a couple reminders for folks that all testimony and questions will be addressed through the chair as we work through this a little bit today. So let's go ahead and get to our business right now. Let's go ahead and pick up the committee agenda. First of all, we are going to talk about Senate Bill 6, and then we're going to go in order. Senate Bill 6 is not going to take us very long. I'm just going to make a statement on that. We're not going to move an amendment, but there's an amendment out there for everybody to take a look at. And it really ties in to some petroleum violation escrow funds that are available, that sit out there. And after many discussions back and forth with not only our ethanol industry, but those who run our fueling stations. There is work left to be done. We tried to pull that together in the short time. Our good commissioner for GOED found this option for us kind of in the middle of the legislative session, so we tried to put it all together, but there's work to be done before it works for everybody else. And so I appreciate everybody trying to get that pulled together in that time, but I understand that over the interim period here, we'll be able to come out with a better product.
Mr. Chairman,
Senator Dibert.
I'd move to table Senate Bill 6.
Thank you, Senator Dibert. We got a motion to table Senate Bill 6 made by Dibert, seconded by Colbeck. Would the secretary please call the roll?
Senators Melhoff.
Aye.
Dibert.
Aye.
Hone. Carr, excused. Colbeck.
Aye.
Larson.
Aye.
Perry. Peterson. Excused. Crabtree.
Aye.
Did he have a yes on that? Did he want to vote on that? Okay. Mr. Chair, we have 6 yeas.
Thank you. After receiving a majority of votes, Senate Bill 6 is hereby deemed tabled. All right, now we'll move on to Senate Bill 76, an act to transfer monies from the Housing Infrastructure Fund to the Revolving Economic Development Initiative Fund, and to authorize loans from the Revolving Economic Development and Initiative Fund for airport infrastructure. We'll take proponent testimony on Senate Bill 76 at this time.
Morning, Mr. Chairman. Bill Even, your Commissioner at the Governor's Office of Economic Development. I believe there's an amendment to Senate Bill 76, Amendment A.
Amendment A has been posted and is out there. Do we have a motion to move Amendment A? It's made by Colbeck, seconded by Perry. Comments on the motion to amend, Senator Colbeck?
Just to get it in the correct form, thank you.
Thank you. At this time, the motion was made by Colbeck, seconded by Perry. All those in favor say aye. Aye. All those opposed say nay. The bill is amended. Go ahead, Commissioner.
Thank you, Mr. Chairman. And so the bill as amended reads, an act to authorize loans from the South Dakota Housing Infrastructure Fund for airport infrastructure. And if I may, Mr. Chairman, just to talk briefly, airport and airport development, regardless of where it's at in any community, in any state, is incredibly important, not only for the citizens, but also for the businesses that are operating in our state. And if I can talk just briefly about the original title of this bill, was designed to provide the Revolving Economic Development and Initiative Fund, the READY Fund, to provide these loans and then have the loans paid back to the READY Fund. And you have in front of you a copy of a document that just gives a little bit of background of the READY Fund. We're not going to discuss this in light of the amendment today, but I do think it's important to get a couple of things on the record, Mr. Chairman. So the READY Fund was established in 1987 by Governor George Mickelson with the original amount of $40 million. That's grown to $151 million, or about just shy of 300% growth. The issue that we have now, though, is that particularly post-COVID, the type of business projects that are coming to the state and or businesses that are in the state looking to expand often find themselves at scales unimaginable that we would have thought of nearly 39 years ago. Some of the early years of some of the loan funds, a typical loan might be about 1.6 million, and now a typical loan is about 14.9 million. And so when you're sitting with about $32 million left in deployable capital, particularly even in light of, think of the announcements of the Mitchell soybean plant, the Smithfield plant, and so forth, many times the Board of Economic Development finds that it's going to have to restrict the ability to loan money to businesses in the state that are looking to expand. Mr. Chairman, we're going to have this conversation over the course of this coming year to make sure that the legislature is aware of those sort of needs as well. On the bill as amendment on Senate Bill 76, both the Sioux Falls and Rapid City airports have embarked on a growth plan, and we will hear from the executive directors of both of those facilities here this morning. And the size and scale of these projects are quite large. So in Sioux Falls, the total project is $51.5 million, and in Rapid City, $110 million. These are in fact doubling the size of these airports. And the reason that they're doubling, and you'll hear from the executive directors, is the fact that we are seeing record-breaking passenger traffic both in Sioux Falls as well as in Rapid City. And you can hear from the managers of the airports on how those are operating. But at the end of the day, this bill, working with the South Dakota Housing Fund and the South Dakota Housing Infrastructure Fund, is very similar to what this legislature did a year ago in funding the Douglas School District in Box Elder with the rapid growth of Ellsworth Air Force Base. And the ability for the governor to partner with the local authorities, the local communities, the federal government, both the FAA as well as our congressional staff, it's important that we partner on these projects because these are public infrastructure projects. This is different than maybe working with a business in South Dakota. And so these are things that benefit the entire state, regardless of who you are, just like roads, bridges, and so forth. And so, Mr. Chairman, I will end my testimony there and turn the floor over to Mr. Dane from Rapid City.
Sounds good. Thank you, Commissioner. Committee members, I just also want to go back here as our next proponent's coming up and talk through. We've got our 4 bills today. Our intention, the good secretary here has got us a room for after session, and I have no intention of this committee being in there. So we will be dialed in on our questions today as we move through this. If we could, I know we've got a number of proponents today. Follow-ups behind this. If you know, please keep it to new remarks for everybody, and let's try to keep this under 12 minutes if we can. Thank you, sir. Go ahead.
Mr. Chair, members of the committee, thank you, and I'll be brief in my comment. My name is Patrick Dame. I'm the Executive Director of the Rapid City Airport. Been the director for 10 years now. About 9 years ago, we started off working towards a project of the development of the airport, also looking at changing how it is that we do our marketing, looking more at major cities in the tourism market, bringing them back into the Rapid City market. It's been wildly successful for us, which is a good problem to have. Based on that, we've seen substantial growth over the last 10 years on this. Just in the past 2 years, we've seen 100,000 additional passengers. So you look at growing from 360,000 passengers to 450 to 460,000 passengers has been a fantastic growth for us. As we work through this growth, in that particular case, has been 26% over the last 2 years of our project. So this project has been 9 years in the making. The initial project is underway, which is an expansion of our head house. That's $70 million that we've put into that. There's been a considerable amount of airport local funding that's been put into that particular project. But what that does is it really gets our airport to the point where it's the heartbeat. We're building the heartbeat of the airport to be able to support the expansion and also to be able to work through the processing of passengers and baggage.
Now we're trying to move towards the concourse development piece of this, which would add 5 additional gates to the terminal. We've been fortunate to recently get an earmark from Senator Rounds and Senator Thune with their great work on this, $20 million earmark. When we look at those earmarks, South Dakota was number 2 in the nation for airport earmarks on this. So it was a great feat in the amount of money that they were able to put forward for both Rapid City and Sioux Falls to the tune of $50 million between the 2 airports. So we're very proud of the work that we've done on that. Dan Lettler and I have both spent a lot of time in D.C. We go there frequently, meet with our delegation. All of this is a partnership. Much like Mr. Evans had mentioned in there, it takes a lot of work to get a major project like this off the ground, and it really is a multi-leg stool to build a big project like this. They really want to see partnerships in this, and part of this is that partnership that we're bringing forward. With the funding that's been put in place recently, as you've probably seen, the City of Rapid City has approved approximately $44.5 million. The $20 million earmark plus our entitlement funding from the FAA. With our project, we're still $30 million short. So the additional $15 million for us is a big piece of this project to be able to allow us to continue to move forward. So the FAA funding, as we've looked at over both of these projects, they've come forward with a substantial amount of funding, but they're just not going to be able to fund a project like this to 90 to 95%. It's just not possible for the available funds across the United States. With that, Mr. Chair, that will conclude my comments.
Thank you. Further proponent testimony on Senate Bill 76 as amended. Further proponent testimony. We'll go in person first, and we'll pick up online following in person. Go ahead, Mr. Rave.
Thank you, Mr. Chair. Members of the committee, Mitch Rave with the Greater Sioux Falls Chamber of Commerce. This funding would be critical to the expansion that Sioux Falls Regional Airport is currently undergoing. I think if you kind of step back and look at what does government do, I personally would say the first thing government does is create and support infrastructure. And that's what this is. This is critical infrastructure to our city, to our state. It's an economic driver. We have outgrown the current state that we're in at the Sioux Falls Airport. And on a personal note, I sure would like some more flight options because I'm tired of getting up at 4 a.m. to get on a plane. So with that, we would urge your support. And I know Mr. Lettler has some comments to further talk about Sioux Falls. So thank you.
Further in-person proponent testimony on Senate Bill 76 as amended.
Mr. Chair, members of the committee, Garth Wadsworth with Elevate Rapid City. I feel like I've made this case for 3 years now, but you've heard me say it. Rapid City is the most geographically isolated metro area in the lower 48. Outside of Alaska and Hawaii, Rapid City is the city furthest away from all other cities, meaning ground transportation, roads, highways, bridges, rail, is far more expensive just because they're longer. The footprint of an airport stays the same regardless of how far away you are from other things. So this is the most efficient means of getting people in and out of the Black Hills, and we appreciate your support. Thank you.
Thank you. Further in-person proponent testimony on Senate Bill 76 as amended.
Morning, Mr. Chair, members of the committee. Mike Bockerney, CEO of the Economic Development Professionals Association of South Dakota. We support the bill as amended. Thanks.
Thank you. Further proponent testimony.
Good morning, Mr. Chairman. Justin Smith, attorney from Sioux Falls, registered lobbyist for the Tourism Coalition of South Dakota. I also have a badge for the Greater Sioux Falls Chamber of Commerce. I've been asked to mention something that didn't get mentioned before by Mr. Rave, and that is that Sioux Falls has agreed to match $5 million if the funds come down from the state. So, that we view that as another reason to support this bill. The tourism industry rises and falls on people being able to get to South Dakota easily, efficiently, economically. Our airports are a huge lifeline of tourism in South Dakota. And so for that reason, TCSD would ask you to please support this bill. Thank you.
Thank you. Further proponent testimony.
Mr. Chair, members of the committee, my name is Sarah Rankin, and I'm the Executive Director of the South Dakota Municipal League. And we would just like to say that when communities have reliable air service, it changes the trajectory of that region. And with that, we support this bill. Thank you.
Thank you. Further proponent testimony.
Good morning, Mr. Chair, members of the committee. Ryan Budmeyer with the South Dakota Chamber of Commerce and Industry. We strongly support Senate Bill 76. We think these investments in airport infrastructure will enhance capacity, improve traveler experience, and attract more businesses and tourism, ultimately creating more jobs, stimulating local economies without imposing new taxes on South Dakota residents. We urge you to support Senate Bill 76. Thank you.
Thank you. Any further in-person proponent testimony on Senate Bill 76?
Mr. Chair, members of the committee, my name is Julie Johnson. I'm a lawyer from near Aberdeen, the registered lobbyist for Homes for South Dakota, which is a nonprofit. It's a coalition of all the nonprofit housing agencies across South Dakota. I'm also the registered lobbyist for a group called HAPPY, Homes Are Possible, Inc., which is the nonprofit housing entity that builds Aberdeen, and very proud of both of those. So I'm also the resident historian on the Housing Infrastructure Loan Fund, along with the chair of the committee, I think. So don't let me steal your thunder, Mr. Chairman. So in the summer of 2021, this legislature had a wonderful summer study on workforce housing. My clients and many other coalition partners, including several that just testified, got together and created some identified needs in the housing sector that could really make a difference. Housing infrastructure was one of those. Actually, it was the top of the list. In the legislatures of 2022 and 2023, then, the bipartisan legislature across both sides of the Capitol did agree with all of that and created the Housing Infrastructure Loan Fund. So I'm not here to testify against airports. I'm here to testify in favor of returning the earnings to the Housing Infrastructure Loan Fund and to keep it going into the future, because we still have a lot of unmet housing needs across the entire state. That's how we believe the amendment to this bill is constructed, and we are not opposing the airport part of that. We just want to preserve the potential for the Housing Infrastructure Loan Fund. You also can be very proud of this fund. It's created amazing opportunities throughout the entire state. The map that was distributed, I think, thank you very much, shows you where many of these projects are located across the state. We have many on deck ready to use these funds into the future. You can also be very proud of the Housing Development Authority in South Dakota. They're very creative. They're very helpful with communities that have these needs. And we want to thank the coalition partners that brought us this far as well, and the governor's office for working with us on returning the earnings from all of this to the fund. I'm happy to give you the whole load on the history of this whole project, which I have in my hand, but I don't think you want that today. But I'll make myself available to do that into the future should it be helpful. Thank you for your help.
Thank you. We'll take further proponent testimony on Senate Bill 76 as amended.
Mr. Chairman, members of the committee, Dean Krogman, I represent South Dakota Multi-Housing, and as amended, we are very much in favor of this. We feel we are supplying the workforce housing, and so we are in support of Senate Bill 76 and hope you will support it as well.
Thank you. Any further in-person proponent testimony?
Thank you, Chair. Steve Duffy, District 32, here representing myself. I've worked on this issue for a long time with a lot of other people. Very supportive. I'm glad to see the money going back to housing. That's a win-win across the board, whether you're flying out for vacations, tourism, airports for package delivery, air ambulance. There's just so many things that airports affect so many people. This is the right thing to keep these airports going. Thank you.
Thank you. Any further in-person proponent testimony? Seeing none, we're going to go to remote testimony. Dan from the Sioux Falls Regional Airport, are you online there?
Yep, I'm here.
Thank you, sir. Go ahead.
Yeah, good morning, Mr. Chairman and members of the committee. My name is Dan Lettler, Executive Director of the Sioux Falls Regional Airport, and I'm here to offer my support for Senate Bill 76. The Sioux Falls Regional Airport's a critical economic driver for our region, generating more than $900 million in annual economic impact. Passenger traffic has grown steadily, averaging 3.5% over the past 2 decades and approximately 6% in recent years, resulting in record employments in 8 of the last 10 years. With 63% of South Dakota's commercial air travelers relying on our facility, our capacity is increasingly constrained. To meet current and future demand, we began construction in August on the first phase of a new concourse and terminal apron, a $70 million investment. Planning is underway for a second phase, estimated at over $50 million, which will add expanded seating, enhanced food and beverage options, and the infrastructure needed for an international gate and customs and border protection facility. Senate Bill 76 is an essential part of our funding strategy. A zero-interest loan will allow us to complete this project and ensure we can accommodate projected growth over the next 15 to 20 years. I respectfully ask for your support of this legislation to help maintain the infrastructure necessary for South Dakota's primary commercial airports, and certainly available for any questions. Thank you.
Thank you. Last call for any proponent testimony on Senate Bill 76 as amended. Seeing none, we'll close proponent testimony and move on to opponent testimony. Is there any opponent testimony on Senate Bill 76 as amended? Seeing none, we'll close opponent testimony and we will waive sponsor rebuttal and move on to committee questions. Senator Colbeck.
Yep, this is for Mr. Even.
Go ahead,
I
Senator
just want to
Colbeck.
understand our options here. So our first option is to leave it as is, or we could take this money out. If we leave it as is, this money remains stagnant, right? There's no way that we can funnel this money other places. We have to statutorily change where that money's going to go, and that's what we're doing here. Is that correct?
Go ahead, Commissioner.
Mr. Chairman. Yeah, Senator Colbeck, the answer is yes. Right now, in order to move this money out of the Housing Infrastructure Fund requires legislative action.
One follow-up.
Go ahead, Senator.
So if we were going to do anything else, like property tax relief or anything like that, we'd have to do a statutory authority on that too.
Go ahead, Commissioner.
Senator Colbeck, yes.
Okay, thank you.
Further committee questions on Senate Bill 76 as amended?
I have a question.
Go ahead, Senator Milhoff.
Thank you, Mr. Chair. Maybe for Mr. Even, maybe somebody else, but so if this passes as presented, as amended, so that would be 3 loans out of that total. Have you had conversation with the authority? Are they okay with doing the service on all those loans?
Go ahead, Commissioner.
Even though they don't really affect housing?
Go ahead, Commissioner.
Yeah, thank you, Mr. Chairman. Senator Melhoff, yes, we have had conversations with South Dakota Housing. They have staff here in the room for technical questions on this. Chaz Olson is the executive director of South Dakota Housing Authority. Extensive conversations with him, as I assume that this legislature had when they were doing the Douglas School District as well. They have a board of directors that then oversees their loan funds also.
Follow-up.
Go ahead, Senator.
So just to clarify, they're capable and ready and willing to do the service on these loans should it pass?
Go ahead, Commissioner.
Chairman, yes.
Further committee questions on Senate Bill 76 as amended? Senator Perry.
This will be for Julie Johnson.
Go ahead, Senator.
Good morning. The purpose of this question is just to find out on the return of money, where is it going? And are you comfortable with what's going to happen?
Go ahead, Julie.
We understand that the bill as amended before you returns the payments to the Housing Infrastructure Loan Fund, which was my client's biggest hope, is that we can continue to use that fund into the future and make those infrastructure dollars available to local housing needs. So we are comfortable with the bill as it is drafted.
So, Mr. Chair?
Go ahead.
Follow up. And so, in your opinion, we're taking care of 2 birds with 1 stone, or actually 3 birds because you got 2 airports and you're going to get the money back to the housing.
That is one way of looking at it. Yes, thank you very much.
Any further committee questions on Senate Bill 76 as amended? Go ahead, Senator Larson.
Question for Commissioner Even, or whoever you want to appoint to this question. Just wondered what was the logic behind the 0% interest, and is that a debatable or something that you would be interested in changing? It seems like a bit of a missed opportunity there for me, from my perspective, but so I wanted to ask about it.
Go ahead, Commissioner.
Mr. Chairman. Yeah, Senator Larson, we modeled this after the Douglas School District alone, since that's public infrastructure for schools. This is public infrastructure for the citizens of South Dakota through the airports, so we kept that the same. The main takeaway was we didn't want to lose the corpus or the principle of the Housing Infrastructure Fund, as Julie Johnson mentioned. So the ability to leverage that fund onto something that's this immediate need while continuing to still have funds available for housing infrastructure. To Senator Perry's comments, you're covering a number of bases with this fund. And so the 0% interest, I think, is important when you look at it through that lens of a public infrastructure investment.
Further questions on Senate Bill 76 as amended? Commissioner, while you're sitting there, I would go through that terms piece with you as well. So I'm looking at section 3, line 13. Be closed and funded on or before June 30, 2030. Just kind of walk us through how the terms work for actually doing that and getting the monies back to HIF, if you would.
Yeah, thank you, Mr. Chairman. So the closed and be funded by June 30th of 2030. It's 2026. This legislature is going to take action. This bill would become law in July 1st of this year. And so you're really looking at a little over 3 years for the airports to understand all of their funding options, many of which are still requests, right? So they're still putting together the funding to go on phase 1, 2, and 3 of their projects. As you also heard from the folks from Sioux Falls, the city of Sioux Falls is willing to match this up to $5 million, and so this actually activates a number of things. It's designed to give the airport authority and the city of Rapid City the flexibility necessary to put the loan programs together with South Dakota Housing.
Any further questions on Senate Bill 76 by anybody? Senator Peterson.
Thank you, Mr. Chair. I may have missed this, but so forgive me if this question's been answered. But when we make loans, are we identifying repayment sources? And I'm wondering what the identified repayment source is for these loans.
Go ahead, Commissioner.
Mr. Chairman, I would refer that to Patrick and Dan to answer from the Airport Authority and the City of Rapid City.
Mr. Chair.
Go ahead.
Under our funding plan.
Introduce yourself again for the record.
Patrick Dame, Executive Director, Rapid City. Under our funding plan at this point, we would look to put it under our passenger facility charge, which we get a $4.50 per in-plane passenger amount back out of the ticket. That would support this loan in how we would look for the repayment of that. Currently, that mechanism supports our 2012 addition that we put on. So that project is going to roll off soon, and we've been collecting more than we're spending on that. So we will move that right into that passenger facility charge as being the repayment piece of it.
And that's the same for Sioux Falls and Rapid City?
Mr. Chair, I'd have to defer to Dan.
Dan, are you still with us?
Yeah, Dan Lettler, Airport Director in Sioux Falls. Yeah, similar to Patrick, we have a passenger facility charge that we're collecting now that we would utilize some of those funds. But primarily our parking, public parking revenue, the construction of a new parking garage, substantial revenue that is being generated from that new facility would help, back those loans.
Any further questions on Senate Bill 76? Go ahead, Senator Peterson.
Probably just a couple follow-ups. So my main concern here, and maybe you can tell where I'm going with the question, is that we're not going to be looking at implementing some sort of new tax or new bond that will be an additional cost to the taxpayer. This will be funded by the users. Am I understanding that correctly?
Yes, that's the PFC is collected from a passenger facility charge from each passenger that utilizes the airport. So no other taxes or fees would be planned at this time.
Thank you. One more follow-up.
Go ahead, Senator.
So again, when we're talking loan terms and conditions, is there collateral that the state is requiring on these loans?
Commissioner, do you want that?
Mr. Chairman, Senator Peterson. Yeah, I can't speak for the South Dakota Housing Authority Board of Directors. That's the board that would oversee all of this. They would have their terms and conditions. I can speak as from the Board of Economic Development. If this was run through us, you have collateralization, and it's pretty clear that these public airports aren't going to pack up and go away. And I think the points that were made by both the executive directors is that there's a funding stream identified as they look out on their cash flow. One of the other reasons, I think, to the question that the chairman had is why is the start date of 2030? It allows all of these things to get lined out and make sure that the pro formas are sent into the South Dakota Housing Board.
Thank you.
Senator Hone.
Thank you, Mr. Chair. I'm not sure if this is for Commissioner Even or maybe Patrick Dame, but so Sioux Falls is kicking in $5 million. Rapid City is not kicking in any funding towards this. Is that correct? And especially when their project total is a lot higher in the amount, can you address that?
Mr. Dame.
Mr. Chair, Patrick Dame, Commissioner Hone, the city of Rapid City has actually recently just passed a vision fund for roughly $44.5 million to go towards the project. So there is a substantial investment from the local community in this. The airport is also directly put in to Project One, I think right now close to $20 million. We're also expecting on Project Two that we'll be committing an additional $20 million. So our total projects as we move through projects 1 and 2 are equating to approximately $200 million. And the reason the difference between the two projects in Sioux Falls and Rapid City is Sioux Falls has the head house infrastructure to be able to support their current gate area expansion. We do not. So we're having to do things like power improvements, gas improvements, water improvements. So we're having to deal with our head house piece of it, which hasn't been touched for many years on that. So we're having to do a heartbeat improvement to the terminal to be able to get to the gate area expansion piece of it.
Any further committee questions on Senate Bill 76 as amended? We're going to close committee questions and move on to committee discussion and or action on Senate Bill 76 as amended. Senator Colbeck.
I'm going to do a do pass on Senate Bill 76 as amended.
We have a motion from Senator Colbeck and a second from Senator Dibert. Comments on your motion, Senator Colbeck.
Yeah, I'm very familiar with the South Dakota Housing Development Authority. I've been on their board of directors and on that board. I know that they'll do their due diligence on that. Also, if I was sitting in a CEO role and my vice presidents had come to me and say, we can use this capital that we have, this money, and we can use it over here in a better way, I think that that's what we should do, especially when we're talking about the money of the taxpayers. We can leverage this to make more and do more. So I think this is a good solution.
Further comments on the due pass motion, Senator Dibert.
Thank you, Mr. Chairman. You know, I agree with everything that the Senator just said, and we also know that regional, when it was first done, was in the 80s, so we know it's been a growing project, so it needs the boost.
Any further committee comments on the due pass motion, Senator Peterson?
Thank you, Mr. Chair. Well, I do like the fact that this is not a tax increase, but it does bring needed improvements to the airport. And the airports, and they are regional airports. They are not used only by the citizens of either Rapid City or Sioux Falls. I think they're used by the whole region, including greater part of the state of South Dakota. So I will be supportive of the motion.
Senator Perry.
Anytime we can do something in South Dakota that improves our tourism, improves our communities, and improves our air travel, we are on the right track. And especially with the amendment that was put on here so that we're able to use that for housing in the future, I think that this is a win-win.
Any further committee comments? Seeing none, the chair would just provide a couple of closing pieces. One, thank you to the commissioner and the folks that worked so hard to put this amendment together so that we could bring this, I think, to fruition and build a lot of support behind it. Certainly the housing infrastructure funds, we'll talk about that more on a bill later today, but I think that's made a great impact across our state, making sure it's more affordable for our next generation to live here and work here. I look at this particular project, and I think the senator to my left here just mentioned it. It really touches every single district because we fly out of either Sioux Falls or Rapid, no matter where we're at. And I think it's an essential piece of infrastructure, which is where government should be at. And when I look at the financing stack that goes into this, lots of big projects require funds from different areas. And you look through this, it is, I think, very appropriate that the state plays a part in this when we see so many others coming to the table to be part of that as well. And so I'll be an enthusiastic supporter for Senate Bill 76 as amended. The motion in front of the committee is a due pass motion made by Colbeck, seconded by Dybert. Would the secretary please call the roll?
Senators Melhoff.
Aye.
Dybert.
Aye.
Hone.
Aye.
Carr excused. Colbeck.
Aye.
Larson. Aye. Perry.
Aye.
Peterson.
Aye.
Crabtree.
Aye.
Mr. Chair, we have all yeas and one excused.
After receiving a unanimous number of votes, Senate Bill 76 is hereby deemed passed. We'll be at ease for 1 minute here.
Mr. Chair.
You have a personal privilege.
A personal privilege before all the blue coats leave.
Perfect. Go ahead, Senator Perry.
We'd like to recognize the Aberdeen leadership team, the Leadership Aberdeen. These are the guys and gals that are going to make the future of Aberdeen better than it is today, and they're doing a really good job. We appreciate them being here.
I do not. All right, we're going to go ahead and pick back up with our agenda here. We are going to go to Senate Bill 204, and I'm going to hand the gavel over to Senator Peterson for Senate Bill 204.
Senate Bill 204, an act to revise certain criteria for loans from the South Dakota Housing Infrastructure Fund. Do we have any proponent testimony?
Good morning, Madam Chair, members of the committee. Casey Crabtree, Senator from District 8, which is Lake, Minor, Kingsbury, and rural Brookings County. On Senate Bill 204, there is an amendment that has been posted.
Would you like that moved at this time?
I would.
So moved.
Second.
Moved by Senator Melhoff, seconded by Senator Dybert. Okay, all those in favor, say aye.
Aye.
Those opposed? Amendment is adopted. Go ahead, Senator.
Thank you, committee, for that as well. So I want to just talk a little bit about what we've got in front of us with Senate Bill 204. A little bit of it needs to go into some of the overview of where we're at with housing infrastructure funds. Many of you have been part of those discussions and obviously got some of the history on the bill before you, so I will not spend a ton of time with that. I do want to point out a couple of things that I think are worthy of noting. There was a handout that's placed in front of you that talks about the Housing Infrastructure Financing Program funded projects. Looks like this right here. I think that's worthy of taking a look at. You can see that there's been a lot of different projects in a lot of areas, pretty widely spread from both our big cities, our two big cities, all the way to our rural communities across South Dakota. A total of 85 projects and a number of units built, both single family and multifamily. I would note that you can see that there's a lot more single family lots that have been built using this housing infrastructure funds. To go back through the details on that, that was a $200 million housing infrastructure funds that were put together. The first $100 million was grants, and the second $100 million was loans. The grants went really quickly. And so the way that the market worked at the time, grants obviously go fast. You don't have to pay it back. But it does a nice job of driving down the costs of homes across our state. And really, that's what this was about, making sure homes were more affordable, that it was more affordable to live here. And that continues to be the number one issue as you cross our state, is making sure things are more affordable. So we look at this particular piece, and we've had success. The loans went quickly, or the grants went quickly, and now we're moving through the loan piece. And the loan piece is really starting to take off and do really well across our state, as we saw the inventory from grants, those lots that were built, those apartments that were built, being moved along. And so we've seen that work through, and we've got an ability today to drive more affordability. And so the thing to take away from this proposal today is it's going to make it more affordable to build these houses. It moves the share from 1/3 to 1/2. And so you can see that on section 2. So really what's that doing is that's driving the cost of building infrastructure for homes down considerably across our state. We are seeing a couple of trends that are really helpful. One, that these investments are happening in our more rural areas. And of course, when it's a much more risky thing for a developer to do. And so what we're seeing is municipalities take the lead on that. And so a municipality being able to use up to 1/2 is essential for being able to do these, especially in our more rural areas. And so with that, I would ask for your consideration. I will stand by for questions and appreciate your thoughtful work on this today.
Thank you. Do we have further proponent testimony?
Madam Chair, members of the committee, Garth Wadsworth with Elevate Rapid City. During discussion of the previous bill, I think the housing infrastructure program was described as being stagnant. I don't particularly love that, but I have a tough time disagreeing with that characterization. So I think we would all agree that the changes included in this bill will help address that slower utilization and improve affordability. Additionally, increasing the limit on the loans helps expand the pool of who's able to access these funds. A 30% limit, you're still required to go out and access traditional private market financing, and the overhead, the reporting requirements for the 30% just don't make sense for a lot of our smaller developers. And so we really see that it's only the larger teams who are able to take on at that 30% limit. Increasing that up to 50% makes it a little more worthwhile their time and expands this opportunity to some of the smaller developers and home builders in the rural communities. So we appreciate your support. Thank you.
Thank you. Further proponent testimony.
Good morning, Madam Chair, members of the committee. Mitch Raver, the Greater Sioux Falls Chamber of Commerce. I would echo the comments of my colleague from Rapid City. This offers some more flexibility, some more utilization possibilities for folks who are looking to do these projects and build more affordable housing across our state. So with that, we would rise in support and ask for your favorable consideration. Thank you.
Thank you. Further proponent testimony.
Madam Chair, members of the committee, my name is Sarah Rankin, and I'm the Executive Director of the South Dakota Municipal League, and we too rise in support of Senate Bill 204. As the sponsor mentioned, this program is essential to municipalities. Across South Dakota, the single greatest barrier to new housing development is not demand, it's infrastructure. The proposed adjustments to the HIF funds are important because they provide greater flexibility and more practical access to financing. Housing projects do not fail because communities lack vision. They fail because infrastructure costs create funding gaps. Allowing communities to close those gaps through stronger loan participation and clearer eligibility standards directly translates into more lots ready for construction and more units available for workforce housing. It is also important that the funding reflects the statewide nature of the housing challenge. Our larger municipalities are experiencing sustained population growth and workforce demand, while smaller communities are working to maintain economic vitality and attract families. Housing pressures look different in scale, but they are equally urgent. A balanced approach ensures that the fund can serve both high-growth corridors and rural communities without forcing them to compete unevenly. The Housing Infrastructure Fund is one of the most practical tools the state has provided to help cities meet housing demands responsibly. Strengthening its usability ensures that it continues to function as intended, as a partnership tool that unlocks housing development while protecting local taxpayers. For those reasons, the South Dakota Municipal League respectfully asks for your support of SB 204. Thank you.
Thank you. Further proponent testimony.
Good morning, Madam Chair, members of the committee. My name is Tim Doherty. I'm a registered lobbyist for the South Dakota Home Builders Association, and we're here in support of Senate Bill 204. In a recent article on the housing affordability crisis, the chief economic officer for the National Association of the Home Builders is quoted as follows: "The solution for affordable housing is the enactment of policies that will bend the construction cost curve and enable additional supply of attainable housing." This bill achieves that goal. It bends the cost curve by increasing the amount that can be loaned for housing infrastructure projects. And I think it's important to keep in mind that this bill and the housing infrastructure program not only helps young families achieve the American dream of owning an affordable home, but also generates a tremendous amount of economic activity in the state of South Dakota. It creates numerous construction jobs. It creates other trade jobs, such as for electricians, plumbers, architects, and engineers. It creates sales of materials and supplies, both at the retail level and the wholesale level. It generates a tremendous amount of sales tax and contractors' excise tax, and also property taxes. So the housing infrastructure program has had a huge economic impact in our state, and this bill will help continue that impact and make housing more affordable for homeowners in South Dakota. Thank you. Hope you'll support the bill.
Thank you. Further proponent testimony.
Madam Chair, members of the committee, my name is Julie Johnson. I'm a lawyer from near Aberdeen and the registered lobbyist for Homes for South Dakota, which is a coalition of all of the nonprofit housing development agencies, and Homes Are Possible, Inc., Aberdeen's nonprofit housing development agency. Thank you, Senator Crabtree, for your work on this bill. The attention to this fund that we got by the announcement that the funds were going to be swept for airports really put a lot of brain power to work around the fund. We had a lot of input from our members and the other coalition partners you've heard from about little tweaks you could make in the Housing Infrastructure Loan Fund to make it even more usable as it was originally intended. That's what this bill does. I really appreciate the brain power of the coalition and everything that has been done to bring it to this point. Thank you for your assistance with this. I'll stand by for questions. Thank you.
Thank you. Further proponent testimony.
Good morning, Mike Bockerty. I'm the registered lobbyist for the Aberdeen Chamber of Commerce and the Aberdeen Development Corporation. Also serve as the CEO of the EDPA of South Dakota, which is the Economic Development Professionals Association. We rise in support of this. I'd like to point out a couple things that were briefly brought up. When we survey all of our EDPA members, the number one request that we receive specifically from our rural communities is the importance of the change that is being proposed in this bill to move the ability to go up to 1/2. This will have a profound impact for our rural communities. It was mentioned earlier briefly that particularly in rural, smaller communities, you have smaller developments. Those are more risky, and lots of times the municipalities are having to take those on themselves. This change will significantly positively impact those smaller communities, give them an opportunity to bring some new infrastructure opportunities to those communities. I'd also just like to quickly echo all the comments from Mr. Doherty. Those were excellent comments. This has a big economic impact when you build when you put infrastructure in, somebody starts to build a house on it, you have a lot of economic turn there. You put a lot of people to work. That's a very positive thing for our state. We ask for your support. Thank you.
Thank you. Further proponent testimony.
Good morning, Madam Chairman, members of the committee. Ryan Budmeyer, South Dakota Chamber of Commerce and Industry. I'll be quick. We think this is good policy that helps support our growing communities and our employers. So we urge you to support Senate Bill 204. Thank you very much.
Thank you. Further proponent testimony.
Good morning, Madam Chair, members of the committee. Matt Krogman, representing the South Dakota Association of Realtors, along with the Brookings Economic Development Corporation. I'm not going to take your time repeating all the reasons why this is a great idea. We would appreciate your support on this bill. Thank you.
Thank you. Further proponent testimony.
Thank you, Madam Chairman. Deb Mortensen, Associated General Contractors. We're here to support Senator Crabtree in this. It's been an excellent program to help stimulate rural housing, and we support it. Thank you.
Thank you. We are at our time limit, but if there are any additional Me Too proponents, I'd be happy to entertain that. Maybe we're just exactly right. Good timing by the sponsor. Okay, so seeing no further proponent testimony, none online, is that correct? Okay, none online. We will move to any opponent testimony. Any opponent testimony in the room? Any opponent testimony online? Okay, seeing none, I will move then to committee questions. Are there questions from the committee?
Madam Chair,
Yes, Senator Milhoff.
thank you for the prime. I was just curious if you engaged with the South Dakota Housing Development Authority, and did they have any input in the language on this bill?
Madam Chair.
Go ahead.
Yep. Thank you, Senator, for the question. Have been in constant contact with South Dakota Housing. They're doing a great job running this. As far as this particular bill, yes, Chaz happens to be out of state today. Otherwise, I think you'd have joined us for the last two bills here. But they are obviously capable of handling this because you're just changing from 1/3 to 1 to a half, and are supportive as well.
Further questions from the committee? Yes, Senator Perry.
Thank you for the sponsor. Madam Chair.
Go ahead.
All right. One of the things that concerns me is in Section 2 on the part that's amended from 30 to 50 and from 70 to 50. I was here when we put this bill together, and Representative Drew Dennert, this is one of those things where he would have fallen on his sword basically because he did not want to have it go 50-50. He wanted it 30% for the Sioux Falls Rapid City, and then the other 70% for the rest of the housing for the other areas of the state. And I've heard testimony after testimony after testimony that this is for rural housing, and this gives less money for rural housing. Can you explain that?
Madam Chair.
Yes.
Senator, I was looking through the copy I have here as well. I would ask you to go back and look through that amended piece. That takes that out and keeps it 70-30.
It goes back to 70-30?
Yes, sir.
Thank you.
You bet.
That helps.
Further questions from the committee?
Madam Chair.
Yes, Senator Colbeck.
I'm just going to ask a nuts and bolts question, if that's all right. So we're going from 30 to 50. All of the normal, and again, I served on the South Dakota Housing Development Authority Board, so all of that authority, all of the litmus tests, I know they have an incredibly low rate of default. All of those things stay the same, correct?
Madam Chair.
Yes.
Great question, Senator. Yes, all those things stay the same. And so we've had a great track record with this. I think the takeaway for this is it's driving costs down, making things more affordable, especially when you're looking at these rural communities that are using this funds. Being able to go up to half of that at 2% versus just a third is making an incredible difference.
Thank you. Further questions from the committee? Further questions? So I have a question for the sponsor. One thing I notice as I drive around my district is we have had a large number of multi-family facilities go up, which is great, and we need that. But I'm not seeing as many or as much development, I guess, related to single-family homes. And so I'm wondering if there's a way to incent that as well, or maybe at a higher rate than we're incenting multifamily, or maybe we do it by population. You know, other districts in the state may need more multifamily, but you know, Sioux Falls has got a lot. So I'd really like to see more single family in Sioux Falls.
Madam Chair, thank you for the question. I appreciate it and understand where you're coming from there as I drive through your community quite regularly. A couple things that I would say is if you look at the map that was provided before, and if we really dive in on Sioux Falls and the projects that are using the housing infrastructure funds, we can see that in Sioux Falls, single family has outpaced multifamily units. So we've had 935 single family units come online and 774 multifamily units in that time. So single family has outpaced that in Sioux Falls. And if you look at some of those neighboring communities that Sioux Falls is a part of, Brandon, also we see that 590 single family units that were able to access this and 481 multifamily units. So we're seeing single family outpace that. I had also ask you to pull out this piece right here. This was a written testimony that was sent in to us from Quinn Reimers, who was going to be here, but they have some flight difficulties coming back. But I'd also just look at, if you page through that, there's a project example for the city of Harrisburg. And it walks you through a couple of issues that are happening there. And unlocking this would help with a major arterial road with the city of Harrisburg. What I would really point to, though, is it leads to about 850 single-family lots. So I really appreciate the question from the good senator there. We all want those single-family units because I think we believe that that's really when you're planting your roots. But we also have to understand that there's market dynamics that have taken place. We've seen inflation at an incredibly high rate for the last 4 years. It's kind of leveling out now. But because of those costs, I think that's why you've seen more multifamily come online there. So I hope that answers your question.
It does. Thank you. Just a quick follow-up. So it does look like, in terms of dollar amount, that single family has outpaced multifamily. Do we have a sense that that will continue? Because I would like to make sure that that continues.
Thank you, Madam Chair. Well, I think the market dynamics on really what people are asking for and using will drive that more than anything. I do believe single family will outpace that because that's really where this project, or where the housing infrastructure funds are more applicable. I think we're seeing that overall. So if you even look at the whole state, we're talking 7,400 single family lots and 5,700 multifamily units. So I don't see that trend changing considerably. I would just say the times that we're seeing when we're seeing apartments come online, I think that's being driven by a lot of market dynamics and affordability issues. So I think our option to really get more single family is to have this rotating. Those, reminder to folks, this is a revolving loan fund. These dollars come back. So I think our chance to build more single family is doing what we're doing here today and changing this from a 1/3 match to a half.
Just one final question. I'm looking at total projects. Do you happen to have a breakdown between multifamily and single family in terms of number of projects in addition to the dollar amounts you've got?
Madam Chair, can you ask that, I guess, one more?
So I'm looking at the bottom of this handout, and at the bottom it says total projects 85, and then it gives the breakdown of dollar amounts between the two. I'm wondering if we have a breakdown of how many projects or single family and how many multi. You can get that to me later if you want, but just curious about that.
Yeah, I think I'd have to probably, Madam Chair, I think I'd probably have to ask maybe housing for that, or maybe Senator Colbeck's got something there.
These are the lots. So 85 created that many lots. And that
Okay. Okay, I think I was misinterpreting the handout. Thank you. Are there further questions from the committee? Okay, seeing none, we will move to committee discussion and/or action.
Madam Chair,
Senator Dibert.
I would move due pass on Senate Bill 204 as amended.
Second.
It's been moved and seconded, moved by Dibert, seconded by Melhoff, due pass. If there's, are there any comments on the motion?
Yes, thank you, Madam Chair. If we look at the western part of the state, which I think I'm the only member that's from out west, we see a significant amount of single families in Rapid City. It's almost twice the multifamily. So it's being effective for single-family residences. And you see the other market areas out there, it's all based on need, as this prime sponsor said. So each of those communities has different needs. But I just wanted to point out that the single-family far outweighs the multifamily. It's a good bill. It loosens this up a little more and have it used more. So that's why I made the motion.
Thank you. Further comments on the motion? Senator Melhoff?
Thank you. Yeah, I think it's a good opportunity to kind of juice the program a little bit and get it working a little bit harder. There's no point in having a bunch of lazy money laying around. Get it out in the community doing good things.
Thank you. Further comments on the do pass motion? Okay, if there are no further comments, those in favor of the motion say aye. Those opposed, no. Madam Secretary, would you please call the roll?
Melhoff,
Aye.
Dibert,
Aye.
Hone. Pass. Carr, excused. Colbeck,
Aye.
Larson.
Aye.
Perry,
Aye.
Hone. No. Peterson,
Aye.
Crabtree.
Aye.
Madam Chair, we have 7 yeas and 1 nay.
So with that, Senate Bill 204 as amended will go to the floor with a do pass motion, and I will turn the gavel back over to the chair.
Next up is Senate Bill 226, an act to increase a limit on video lottery gaming and to deposit monies into a new fund. We will take proponent testimony on Senate Bill 226 at this time.
Good morning, Mr. Chair, members of the committee. It's great to be in Senate Commerce and Energy 2 times in a row now. So, yeah.
We wish there were 10 more of you, Senator.
Well, who doesn't? Thank you. I appreciate that. Before I get started, I'd like to move an amendment, the 226A.
So
Mr.
moved.
Chairman.
226A has been moved by Senator Peterson, seconded by Senator Dibert. All those in favor, please say aye. Aye. Those opposed say nay. Your bill is amended, Senator Shanefish.
All right, thank you. So Senate Bill 226 would increase the bet limit from $2 to $5. Here, and from my understanding, video lottery was established about 1989, which is just 2 years after I was born, so I don't mind giving away my age there. But there's not a lot of things that cost the same as it did back then, but video lottery, the bet limit is one thing there, and this would provide a tool to maybe generate a little more revenue, and also revenue that would provide some property tax relief. With the amendment, it would be after the limit gets to $175 million now, and it would have an annual increase, which just kind of addresses some of the budgetary concerns that might have been out there. And we'll hear some about the revenue and the tax relief, but just another thing. I represent some rural areas and small towns, and the local bar might be one of the few choices you have that provides a place for people to go eat. They're they might provide a spot for where some of the town members gather for their morning coffee, or provide senior meals, and the local eateries are, like a lot of businesses, are struggling, operating at either narrow profit margins or maybe operating at a loss. So this also gives them a tool to just maybe have another way for their business to do a little better, which is vital to our small town. So I'm going to let others testify on the bill. I've just asked for your thoughtful consideration of Senate Bill 226. Thank you.
Thank you. I'll take further proponent testimony on Senate Bill 226 at this time.
Good morning again, Mr. Chair, members of the committee. Matt Krogman, representing the South Dakota Licensed Beverage Dealers and Gaming Association, which is an association made up of your local restaurant, bar, video lottery establishments that you have in your local communities. First, let me say what this isn't about. This is not about expanding gaming. This doesn't lead to any new locations. It doesn't lead to any new machines. This is about, you guys have been talking property taxes for years. This is about giving an idea of providing some property tax relief that doesn't require a sales tax increase, potential property tax relief, I should say, without having to increase the sales tax. The thing with the sales tax increase is that our citizens have no choice. They're automatically increased when you increase their sales tax. When you're talking about revenue from gaming, whether you personally agree with gaming or don't personally agree with gaming, whether you choose to participate in it or don't choose to participate in it, the fact is, if you don't participate in it, your taxes aren't going up. It's for those who choose to. And so we wanted to provide another avenue option to provide potential property tax relief that doesn't require increasing the sales tax. So that's our point about this. Again, it's not about expanding gaming. To give you an idea of, Montana increased their bet limit from $2 to $4. In 2022, the revenue was $161 million. In 2026, it was $237 million, an increase of $76 million in Montana. We're not saying this is the exact answer for, I mean, it's not going to generate enough to provide maybe the property tax relief that some of your goals that you might have as goals, but it can be part of whatever's decided by the legislature. Again, this isn't about expanding gaming. Onto the amendment and the reason that we're at 175 million. The last budget's revenue was roughly 165 million from video lottery. So we started at 165 million. In discussions with BFM, which were great to work with, if we left it at 165 million, it would create a hole in the current budget, and so we increased that to 175 million. So the first 175 million would continue to go to the state to fund education, to fund everything that the state general fund does. Above that would then go into this property tax reduction fund. And so that's our intent. There's no guarantee that 175 million will ever be hit. We don't know. We don't know until the bet limit increase goes into place. But our intention is to try to provide an answer, help provide an answer to the property tax problem that we have. Again, I'll reiterate, this isn't an attempt to expand gaming. There's no more locations, there's no more machines, there's nothing like that. This is an intent to provide another option for you guys to consider as you're trying to consider property tax relief, and we would appreciate your support on 226A. Thank you.
Thank you. Further proponent testimony on Senate Bill 226 as amended.
Mr. Chairman, members of the committee, Bill Van Camp. I'm a lawyer from Pier and registered lobbyist for the South Dakota Retailers Association. So the prime knows on this bill in 1989, I was a college intern in the treasurer's office downstairs. It's nearly 40 years and I still can't get out of this building, evidently. The retailers have had a long history since 1989 in this space, and we've always been supportive of efforts over time to reflect that inflation occurs and the bet limits, in our opinion, are too low, and the maximum amount that you can win is too low. This is a step. I understand that the purpose of the bill is to provide an option to help with the property tax issues in the state, but as long as there's something that moves some of these things forward in the area for lottery retailers, who a lot of our members are, whether they're big lottery shops or if it's just a mom and pop gas station in a small town that has a few machines, we think it's a positive step, and so we support the bill.
Thank you. Further proponent testimony on Senate Bill 226 as amended.
Good morning, Mr. Chair, members of the committee. My name is Lindsay Ryder-Rapp, and I'm a registered lobbyist for the Music and Vending Association of South Dakota, which represents a number of the state's lottery partners. Since we're bearing all here this morning, I didn't know that I was about 8 years older than Senator Schoenfish, so I'm feeling rather old here today. But as everyone has indicated here, the bet limit has not increased, frankly, in over 35 years. So that has not taken into consideration inflationary adjustments. We believe the modifications sought in this bill, it's a novel approach to looking at the issue that you're all being confronted with here this legislative session, and that is property tax reform. And so with this measure, as the prime sponsor has indicated, any revenues in excess of the $175 million would be directed towards property tax relief. From our perspective, it's a win-win to the state's lottery partners and also the residents of the state of South Dakota in the form of property tax relief. And so for those reasons, we do support it. Thank you.
Further proponent testimony on Senate Bill 226 as amended. Any further proponent testimony? Seeing none, we'll close proponent testimony and move on to opponent testimony. Welcome.
Morning, Mr. Chair, members of the committee, Norman Woods, Family Voice Action. Trying to figure out 1989, if my parents lived in California or if they had recently moved to Pierre. I definitely didn't exist yet, but I think they had maybe moved to Pierre. My dad had a government job. So that's about all I can add to the 89 story, but a few questions we want to ask about the legislation today. And I want to start by, I was telling a few friends this, or a few of your colleagues the other day. Many of you know my wife. If you want to get her really, really fired up, ask about property taxes. It's not fun. But what I don't want on our next property tax bill is a however many dollar amount reduction because we took more money from addicts. I'm not interested in that reduction on my property taxes. So when we're asking these questions about all the different property tax options that are being discussed this year, one key question you guys are asking with other options, if we tweak other taxes, is if we're going to reduce revenue from property taxes because we're reducing the taxes, should we take money from other places? Where's the other money coming from? And so if you had a proposal in front of you to say, okay, we're going to reduce property taxes and we're going to increase taxes on food, diapers, and clothing, a lot of you would probably raise your eyebrows and go, wait a second. We're reducing property taxes and maybe increasing taxes in a way that would hurt the people who maybe need a break the most. And you'd maybe raise your eyebrows at a proposal like that. I would say this is in a lot of ways similar. Here's why. If you look there at that first graph, this was a study from our neighbors up to the north. They said, okay, in just a small percentage of the players, most of them who have a gambling problem, how much of the revenue comes from them? So that study found that 6% of the players brought in 96% of the revenue. So we may say, oh, well, only 3% have an addiction problem, only 4% have an addiction problem, or whatever that number is for different states, for different areas. It's only a small percentage of the people. But look at how much of the revenue comes from them. Similar, they went even narrower. Okay, let's just take the 1% that spend the most. Even the 1% of players was still over half the revenue. Should we be reducing property taxes with dollars from people who have a gambling problem? The two graphs below that just show a little bit more breadth of, if you look at, okay, live casinos, all the different games, fairly similar numbers. If you look at slot machines, fairly similar numbers, just to give some continuity of, video lottery may be the most pronounced, but those same ratios kind of apply to other gaming as well. The next little box below, it says the cost of $1. Multiple groups have estimated for every dollar you raise from something like this, what does it cost society? The most specific study I've seen listed just a few problems in society, like fraudulent claims or treatment or things like that. That study was able to come up with $1.27. That's the smallest number I've seen. For every dollar you bring in, you end up spending $1.27 in societal costs. Other estimates that look more broadly at the whole range of societal costs have come up with as high as $3. For every dollar you make, you're spending $3. Should we be giving a reduction on property taxes by taking more money from addicts and increasing our societal costs because of it? You can see a few of the societal results, which we've talked about before, the addiction rate, the suicide rate, the embezzlements, et cetera. We'll skip over that for now. I think I've talked with all of you about that before. Towards the bottom, you see most addicted states. South Dakota still ranks number 2. And that's not just percentage of those who are addicted. They actually look at questions like this. Like, is the state reliant on the revenue? They look at most casinos per capita, et cetera. South Dakota still ranks number 2. And I'm not so sure that's something that we should be proud of or should continue. And just finally, they've said, okay, we haven't updated this in 35 years, almost making it sound like things are really struggling for video lottery. But if you look at their reports, lottery across the board, almost every year they celebrate setting a new record. So for those reasons, we would ask you to pause and not pass this legislation. Thank you.
Further opponent testimony on Senate Bill 226 as amended.
Good morning, Mr. Chairman, members of the committee. I'm Michael Pauley, Executive Director of the South Dakota Catholic Conference. We represent the Catholic Bishops of South Dakota. Catholic Conference is opposed to Senate Bill 226, which, as you've heard, would more than double the amount of money that can be spent on a video lottery machine game. By design, video lottery is psychologically addictive, and the harm it does to individuals, families, and communities is well documented. And as you heard from the previous testifier, a recent study says that South Dakota has become the second most gambling addicted state in the nation. And I just have to ask the question, are we in a race to the bottom? Is that really where we want to be? We believe that this bill would take an already problematic industry and increase the potential for harm to our communities and families. And so for those reasons, we'd urge you to oppose Senate Bill 226. Thank you.
Thank you. We'll take further opponent testimony on Senate Bill 226 as amended. Any further opponent testimony? Seeing none, we will close opponent testimony and open it up for sponsor rebuttal.
Good morning again, Mr. Chair, members of the committee. Matt Krogman, South Dakota Licensed Beverage Dealers and Gaming Association. I understand where the opponents are coming from. We don't deny that there are people who are addicted to gaming. We don't deny that there are people that are addicted to a number other things. In fact, the South Dakota Lottery transfers money annually to the Department of Social Services for the treatment of anyone who might have a gaming problem. We get that. The fact is, and the other point I would like to make is when you look at a number like $165 million from last year generated from video lottery, and you look at a number of us using in this bill $175 million, it might be easy to say that that amount's going into the pockets of the owners of these establishments. No, the owners of these establishments cover every expense of running this business. And I know you don't like to hear it, but video lottery is a business. And that's the point that has been made about not changing since 1989. If your business hadn't made any adjustments to your business model since 1989, you're not in a great spot, probably. The point about it being, I mean, the business operators cover every expense to operate this industry. They cover the cost of the location, whether they purchase or rent. They cover the cost of the machines. They cover the cost of the employees. They take on the liability of anything that might happen in their establishments. They're the ones incurring all the costs. The state's incurring none. And so when you don't focus on that number, because it's different for our business owners throughout the state. So we understand that there are some people who have problems with this. And to that end, again, we help support Department of Social Services. We feel bad for them. One opponent mentioned paying for food and diapers. one of the things with increasing the sales tax is that you're increasing the sales tax for that single mother or single father who has to buy diapers and has to buy food. You're automatically increasing that sales tax on them if they, those are no choices. They have to purchase those. And if they're renting, they're receiving no benefit from the property tax reduction. That's our whole point of bringing this idea. This idea is being brought to give you another option to be able to provide property tax relief without hurting everyone. So, again, we would ask for your support on Senate Bill 226A. Thank you.
Thank you. We will close sponsor rebuttal and open it up for committee questions. The chair would just guide the committee a little bit to be mindful of our time when we're asking our questions, so make sure they're direct, succinct, and are finding us new information. With that, I would, Senator Peterson.
Thank you, Mr. Chair. I think this is probably for the sponsor.
Senator Shanefish.
Good morning again. So Section 1 creates a new fund, and I'm wondering if that is duplicative of what has already been created or is in the process of being created, working through the system by Senate Bill 125.
Okay.
Senator Shanefish.
Thank you for the question. Kyle Shanefish, Senator for District 19. I think there's been some discussions on that, and I know the sponsor of that bill is on the committee, so we're trying not to, we'll make that work together if it were to move through the process. And
Senator Shanefish is phoning a friend there to Senator Dybert.
And he's a great friend, so I'm
Thank you, Mr. Chairman. We have spoke. 125 is not through the process yet. If 125 runs through the whole process ahead of this bill, then we've talked about amending this bill to go into that fund. If 125 dies, the bill will run alone.
Senator Peterson.
I think that answers that question. Thank you.
Any further committee questions? Senator Perry.
I'll go with the opponent, Mr. Norman.
Go ahead with your question, Senator Perry.
We talk about unintended consequences, and we talk about expense for the Department of Social Services, Department of Health and Public Safety. Can you expound on that just a little bit, and why adding this, even though they say it's not for gambling? It seems like if you have a 150% increase in gambling, it might be for gambling, but you go ahead and tell me.
Go ahead, Mr. Woods.
Chair, Norman Woods, Family Voice Action. Yes, we have a lot of discussions about the dollars set aside for addiction treatment. We recognize those and are grateful for them. I think it's been mentioned that multiple years they don't use up all the dollars. And I think the important point to keep in mind there is that it's estimated that only 6 to 12% of addicts will ever come forward for help. So the point that, okay, we haven't used up all the addiction help dollars, therefore we're solving the problem, the math doesn't add up, because only a small percentage of those who are struggling will actually come forward for those resources, come forward and ask for help. So the fact still remains that you're increasing the dollars coming from the machines, and like the graphs I showed you, we know who the dollars are coming from.
Further committee questions on Senate Bill 226. Senator
Mr.
Peterson.
Chair, thank you. I have a question for, I think it's Mr. Krogman.
Go ahead, Senator.
Thank you. Mr. Krogman, you had mentioned that the Lottery Commission sends money, gives money, transfers money to DSS to help with programs for those who might be addicted to gambling. Can you tell me exactly what those are and how folks would access those?
Mr. Chair.
Go ahead.
Matt Krogman, South Dakota Licensed Beverage Dealers. I don't know the specific process. I believe if someone called the helpline, it helps with the DSS overall budget to provide relief for anyone who needs it and reaches out for it.
Go ahead, Senator.
So it's just an amount that goes into their general budget. It's not funding specific programs.
Go ahead.
Better question for
Thank you,
DSS.
Mr. Chair. Yeah, I honestly don't know their budgeting process.
Okay. The reason I ask is just because I've looked for those things before on similar type bills, and I've had a hard time finding specific programs that help. So I just thought you might have that information. Thank you.
Further committee questions on Senate Bill 226 as amended? Seeing no, Senator Perry.
Sorry, I'll go with Michael.
Go ahead, Senator.
My question is on the type of people that are gambling or the people that are using video lottery. We'll use just using video lottery. Is this rich people, hardworking families? Is it taking money from those who can't afford to do it, or is it taking money from those who have excess?
Mr. Chairman, thank you, Senator Perry. Certainly, in my research on the issue, what I've read is that the people who are the addicts they tend not to be the wealthy folks. It tends to be the people who can least afford it, who fall into these addictions, and then of course their families suffer considerably because they're not able to meet their responsibilities as providers. Did that answer your question? Thank you.
Any further committee questions? Seeing none, we'll close questions, move on to committee discussion and
Mr.
or
Chair.
action on Senate Bill 226. Senator Peterson.
Thank you, Mr. Chair. I move 41st day.
Second.
There is a motion to defer to the 41st day made by Senator Peterson. Who had the second? Senator Hone. Comments on the motion, Senator Peterson.
Thank you, Mr. Chair. Well, for several reasons, I oppose this bill. For one, I do think we have a bill moving through the process that creates a similar fund, so I don't know that this is necessary. Secondly, I do object to increasing and actually doubling the gambling limit, and I do think that is an expansion of gambling. And I do think that we don't have programs that specifically address folks who need the help, and if we do have programs, I don't think we have enough to do that, and I think there's a much greater cost than we can really even define. So for those reasons and others, I would ask that you support the 41st day motion.
Senator Hone.
Thank you, Mr. Chair. I echo the comments of the previous senator, and I just don't want to be on the trajectory of putting South Dakota as the first most addicted state, and I really disagree, I guess, with this concept, and so I'm going to be a no.
Further comments on the motion to defer to the 41st day, Senator Perry.
I need to comment on this simply because this deserves more attention, more review. 150% increase in expense for an area where we have people that are hurting and struggling, and they said we could move from number 3 or number 2 to number 1. This helps ensure the fact that we'd be number 1. And I don't think we want to be number 1 in this area. So I have voted consistently against gambling items, except for one time recently, but I'm a no.
Any further comments? Senator Melhoff.
Mr. Chair, yeah, I'm gonna support the 41st day motion. I think it's been around since 1989. The bet limits haven't gone up, but it has changed a lot from the games that were available back in the day to what we have now. They're much more alluring and interesting to folks, and I just don't think it's a good way to solve our property tax problems. In fact, the only good thing about this bill is an addict can lose his whole paycheck and be home before dinner at $5 a pop. So I think leaving it at 2 is high enough.
Any further committee comments on the motion to defer to the 41st day? Seeing none, would the secretary please call the roll?
Senators Melhoff,
Aye.
Dibert,
Aye.
Hone. Aye. Carr excused. Colbeck.
Aye.
Larson.
Aye.
Perry.
Aye.
Peterson. Aye. Crabtree.
Aye.
Mr. Chair, we have all yeas and 1 excused.
After receiving a unanimous number of votes, Senate Bill 226 is hereby deferred to the 41st day. With that, I'll turn it over to Senator Peterson.
Next on our agenda, we have Senate Bill 193, an act to clarify the definition of backup electric generation. Do we have proponent testimony? Senator Crabtree is making his way to the mic. Morning.
Good morning, Madam Chair, members of the committee. Casey Crabtree, Senator from District 8, Lake County. A couple of things I'll just point out as we get this bill started and wrap up your hearing today. Is I want to make this point crystal clear when we're looking at backup generation. Something that you'll hear and look at as you examine this that I want to point out, though, is that this is not connected to the grid. So I can't stress that enough. This is much different than what we've seen before. This is individual customers who put these systems in, and then they use these when the power is interrupted. We should encourage this because those types of facilities will come offline before things that are critical. And so I like that, but I really want to stress this as you guys go through this, that these are not connected to the grid. A couple other things to point out is local control. Locals have all the control and oversight when it comes to this bill. That remains where it is today. So the local process is intact, and there's plenty of opportunities for locals to work through this process together. And finally, I would just stress that I think this is a little bit more of innovation and a lot less of regulation when you look at this. Not connected to the grid, so it's different than other things that we've seen here before this committee, and this gives us an opportunity to really cut through some of the regulation that exists here today. So with that, I will turn it over to a list of proponents and stand by for questions.
Thank you for the proponent testimony.
Good morning, Madam Chair, members of the committee. Katie Sieverding with Applied Digital. So as the Senator said, Chapter 4941B requires electric generation in excess of 100 megawatts to undergo the regulatory review and siting process from the PUC. The definition, it's broad, so backup generation would be in this. It creates a situation where the primary facility may not be under the jurisdiction of the PUC, but the backup generation, if it exceeds 100 megawatts, would be. And we don't believe that makes sense. So from Applied Digital's perspective, if we were to have a facility, backup power is necessary for three different reasons. We're protecting our workers and our equipment from unintentional harm caused by unexpected disconnection. To allow, number two, to allow our large load to operate off-grid in emergency situations, and to satisfy risk mitigation from our tenants. So we believe this amendment, presented in Senate Bill 193 will correct that and bring it back to the intent. So the things that are interconnected to the grid require the siting, but anything not connected to the grid would not be. A couple of things: state level siting requirements for on-site backup generation are rare. Business-friendly states, Alabama, Arkansas, Idaho, Indiana, Kansas, Michigan, Mississippi, Missouri, North Dakota, Texas, and Wyoming don't provide such requirement. Minnesota, on the other hand, does have this state level siting. So like the Senator said, we think that the siting or the local control, they still have every right and we would expect them to have ordinances to cite on noise and other things related to the backup generation, but not at the state level. The backup generation must comply with local control, but also on the environmental side, any requirements by Danner, those are also still in place. So this is just removing the requirements for siting of the PUC. So in the case of a data center up in Ellendale, North Dakota, we would like to have start construction on a building and have the backup generation inside that building. I think that helps with the noise and other issues. And if we have to cite this at the PUC level, at the state level, it will delay that process and possibly push that backup generation outside. And we would like to bring it inside for those reasons. So for that, I would ask you to support Senate Bill 193. Thank you.
Further proponent testimony.
Good morning, Madam Chair and members of the committee. My name is Kevin Koba. I'm a registered lobbyist for Otter Tail Power Company. Otter Tail Power Company is an investor-owned electric utility that operates over a 70,000 square mile area in Minnesota, North Dakota, and South Dakota, serving about 135,000 customers. My math says that's less than 2 customers per square mile, so we're a very small rural utility company. Otter Tail Power urges a do-pass recommendation on Senate Bill 193. Senate Bill 193 defines backup electric generation and exempts it from the state's siting process. This bill will improve grid stability by allowing large facilities, such as data centers and other major energy consumers, to deploy backup generation quickly and without unnecessary regulatory barriers. Backup systems provide critical support during outages or peak demand, reducing strain on the grid and ensuring that essential operations can continue uninterrupted. This not only benefits the facilities themselves, but also protects utility customers by minimizing the risk of widespread disruptions. Furthermore, by enabling large energy users to rely on backup electric generation during times of grid instability or power supply disruption, Senate Bill 193 enhances the reliability of power delivery for all customers. This flexibility helps utilities maintain consistent service while avoiding unnecessary stress on the broader electric system. Similar legislation such as this was passed in North Dakota last year, and we would strongly urge a do-pass recommendation for Senate Bill 193. Thank you, and I'll stand by for questions.
Thank you. Further proponent testimony on Senate Bill 193.
Morning, Madam Chair, members of the committee. Brett Kennecke from Custer, registered lobbyist for the South Dakota Electric Utility Companies. We're supporting this piece of legislation this morning. I think it's important to talk about a difference in processes. If there's a siting permit required under state law, then that's a contested case hearing in front of the Public Utilities Commission that necessitates the hiring of lawyers. It's essentially a trial with witnesses. People have to travel to Pierre typically for those hearings. It's not unheard of that they're held elsewhere, but in most cases they're held in this building in one of the rooms on this floor. And in this case, it would be to what? Well, enforce the local noise standards. We don't have a state noise standard, so the local people set their noise standard, and that's the one that would be implicated. You're looking at an air quality permit probably from the Department of Agriculture and Natural Resources. That's a separate process over there, not implicated here. In almost all cases, these people would be building their backup generation on their own site, controlled by them. There's no attachment to the grid, there's no wires, there's no eminent domain, and what you're left with is no reason for statewide regulation at that point. The counties and cities are inherently able to handle these matters, enforcing their own standards. People are having their meetings at home at night in front of people that they know. It's just all upside from my point of view, and so I would urge you to pass this out. Thanks.
Thank you. Further proponent testimony on Senate Bill 193.
Good morning, Madam Chair. Aaron Scheibe, attorney in Pierre, registered lobbyist for Clean Grid Alliance. Clean Grid Alliance is a membership organization of about 50 members with an interest in wind, solar, battery storage, and transmission in the upper Midwest. We would urge you to pass this legislation before you today. In terms of grid infrastructure, the change here makes good sense. You've heard about how this is used in practice in facilities, how it does promote stability on the grid. And on that basis, we would, again, urge you to support this legislation. Thank you.
Thank you. Further proponent testimony.
Thank you, Madam Chair, members of the committee. Bill Van Camp. I'm an attorney in Pierre, up here representing NextEra Energy Resources. NextEra has developed at least 5 large-scale wind projects in South Dakota, NextEra is also all of the above, a developer of utility scale of projects, gas, hydroelectric, solar, wind, nuclear. We'll build what our customers ask us to build, where they ask us to build it. We've in fact built a 200 megawatt wind farm in South Dakota to sell it to an investor-owned utility recently. We think this bill makes a lot of sense. We're in discussions across the country with people that want to utilize on-site project-specific energy production, and we would hope that this would pass, as it will speed up the process in the development of projects like this. Thank you.
Thank you. Further proponent testimony on Senate Bill 193. Any proponent testimony online? No proponent testimony online. With that, we'll move to opponent testimony on Senate Bill 193.
Madam Chair, members of the committee, Chris Nelson, Chairman of the Public Utilities Commission, and it is with some trepidation that I rise to oppose the good chairman's bill today, and that's probably not in the category of wisdom, but here I am. I want to let you know that the 3 Public Utility Commissioners do oppose the bill, ask that you defeat the bill, and I'd like to share with you why. If you look at the title of the bill, it talks about simply a clarification of a definition. Well, I submit to you that this is a whole lot more than a clarification of a definition. By creating this definition, you exempt an entire category of facilities that would normally go through the siting process that's established in Title 4941B from examination by the Public Utilities Commission. And so it's a substantive change. I'd like to talk just a little bit about the purpose of Chapter 4941B. And the legislature has established the purpose, the reasoning that the PUC has a siting process. And they've established that in 4941B1. And I want to read just 2 sentences. The legislature finds that energy development in South Dakota and the northern Great Plains significantly affects the welfare of the population, the environmental quality, the location and growth of industry, and the use of natural resources in the state. And it goes on. It is necessary to ensure that the location, construction, and operation of facilities will produce minimal adverse effects on the environment and on the citizens of the state by providing that a facility may not be constructed or operated in the state without first obtaining a permit from the commission. And so in that chapter, it lays out all the different kinds of facilities that are required to get a permit from us, and you're well aware of those, and one of those are energy generation facilities that are greater than 100 megawatts. And so as has been testified to, what this bill is asking is that some of those facilities that are greater than 100 megawatts be exempted from the examination that is anticipated in Section 1 of 4941B. And that, ladies and gentlemen, creates a real disparity. And that is perhaps our greatest concern. And I want to give you an illustration of what can happen here. So let's say that some business decides they want backup generation, and that's great. And let's say they want to put in a 500 megawatt natural gas turbine or a 500 megawatt backup diesel generation, and they tell us that it is for a temporary basis and therefore under this change would not need to go through the PUC process. And at the same time, if one of our utilities or Basin Electric on behalf of one of the co-ops wants to do a 100 megawatt generator across the street, they're going to have to go through the entire siting process. And so I think you really have to wrestle with that disparity of why we would say a 500 megawatt facility doesn't need examination by the PUC, but a 100 megawatt facility does. And maybe that's a bigger conversation that needs to be had, but there's a real disparity in that. I will close with this. The other question that this really begs for me is, let's say the bill passes and a facility avails themselves of this and they build their backup generation, and they're telling us we don't need the PUC permit, this is temporary, it's not connected to the grid. and therefore we don't need a permit. And so they go ahead and they build the facility and they don't have a permit. And then for some reason they maybe market conditions change, and instead of using it as temporary backup, they want to decide to sell into the grid. They want to provide reliability by selling onto the grid market. We love that, okay? We want that flexibility. But because it's been built under this particular definition of being temporary, either they would be precluded from doing that, which I don't think is probably a good, or they would go ahead and do that and have really skirted the PUC siting process in doing so. And so this simple clarification of definition, I think, raises a lot of questions that we ought not ask. The very last thing that I will say is, there was a lot of stress about the fact that, these facilities would not be interconnected with the grid. And whether they're interconnected with the grid or not, building large facilities still has impact on people and environment and the area, and ought to have the same examination that we would give for any of those. Madam Chair, I'd be happy to answer questions when appropriate. Thank you.
Thank you. Any further opponent testimony to Senate Bill 193? Opponent testimony? Seeing none in the room, do we have any online opponent testimony? No online opponent testimony. With that, I will close testimony and offer the sponsor rebuttal.
Thank you, Madam Chair, members of the committee. I appreciate the opportunity to offer a little bit of rebuttal. I think the good commissioner is right 99% of the time. Today's the 1% he's not. And I'll just go back and I want to point out a few things that are different in this language. One, it's very clear that, and I started with this, that this is not connected to the grid. Not connected to the grid. That entirely changes the scene, what we're looking at in 4941B, because we do agree on how 4941B is set up and what the legislature found and what they needed when it comes to developing energy sources. But I can't stress this enough, that this is not connected to the grid. And I would go back to and talk about the example that was brought up about a facility building one of these and then one of those regulated utilities. The difference that you have here that I think you need to pay very close attention to is those are regulated utilities versus customers. These are customers. These are individual customers, companies that are putting these in, okay? And so I just really want to point that out. And again, it's because the utility is connected to the grid. That's the key difference that I'd really like to point out to you guys. And so really what we're talking about here is unnecessary regulation. And I think we all believe that we need proper regulation to make sure siting works well for those who are there. So a couple of the other examples that the good commissioner brought up are already handled by the local process and local control. Those are handled with that. And then we talked a little bit about things that already fall underneath Danner. And so we are literally talking about an extra piece of red tape that is here today that other states have clearly cut. Places like North Dakota. And the places that keep this in mind are places that we've traditionally found not friendly to business, like Minnesota. And so I would encourage you guys today to move forward with this because it's common sense. I'll stand by for questions.
Thank you. With that, we will close testimony and rebuttal and open it up to committee questions. Senator Colbeck.
So I have one for the commissioner here. Madam Chair. Thank you. So that does bring up a good point. I mean, when we talk about backup generation, so let's just use a hypothetical, bunch of diesel generators. Those are regulated at the stack when you buy a diesel generator, right? So those emissions are already regulated. So like I drive a diesel truck. I would think that would be good. So if we do noise, it's going to be, would be regulated at either the city ordinance or maybe the county ordinance. So in my mind, this is kind of a doubling or tripling of regulation. So do you believe that there would be something else? I mean, are you envisioning a natural gas turbine, or what exactly would this backup be? That you would think that needs to go to another level?
Go ahead.
If I might, Madam Chair.
Just please announce
So
yourself
to answer
again.
your first question.
Sir, just please announce yourself
Yeah,
again.
Chris
Thank you.
Nelson, Public Utilities Commissioner. Are emissions regulated at the federal level? The answer to that is absolutely yes. All of the things that you talked about are things that would apply if a utility were building a generator, okay? And yet, our statute, 4941B, anticipates that if it is a 100 megawatt or larger generator, that it should be examined by the Public Utilities Commission. And then the statute goes on to provide criteria that we are to examine that against. And those criteria in 4941B22, and it talks about, will the facility pose a threat of serious injury to the environment or to the social and economic condition of the inhabitants or expected inhabitants of the siting area? Will the facility substantially impair the health, safety, or welfare of the inhabitants? Will the facility unduly interfere with the orderly development of the region? There's a whole number of things that the PUC by statute is required to look at when evaluating a facility. And so it goes far beyond kind of those two things that you mentioned, Senator.
Follow-up, Senator.
So it's your interpretation that the statute applies to anyone, not just Public Utilities Commission or public utilities as defined. That's what I think that's maybe the crux of the disagreement.
Go ahead.
If I might, that is correct. Yeah, there's no exemption here for a facility based on who owns it, who develops it, or whether it's connected to the grid or not. It simply says if you are building a facility that's 100 megawatts or larger, then it needs a PUC permit.
Additional follow-up? Further questions from the committee? Senator Hone.
Thank you, Madam Chair. For Commissioner Nelson. Could you comment on the good senator's rebuttal and give us your thoughts?
Go ahead.
Yeah, I think maybe our real difference is, he stresses the fact that this is not connected to the grid. And as I read 4941B1 and 22, when it talks about the things that we are to look at, and the reason this permitting process exists from the beginning, it doesn't say anything about whether it's connected to the grid or not. It doesn't matter. It's all about us looking at that facility and what is the impact of that facility on the people and on the environment and on the place where it is located when it's built and when it's operated. Whether it's connected to the grid or not, that's a where does the wire run question, not how does it impact the people, place, and environment.
Follow-up? Further questions from the committee? No further questions from the committee. Okay. With that, we will move to committee discussion and/or action.
I just have some discussion.
Yes, Senator Colbeck.
So I understand the good public utility commissioners. I understand their argument. I just happen to disagree with it. I think that if we're talking about things that are on the grid, and I get that the law doesn't differentiate, but if we're talking about something and someone's going to use on their own, that's one thing. But if we're talking about something that's going to go on the grid, so maybe we're talking about batteries, maybe we're talking about something that doesn't make noise, maybe we're talking about something the size of semi-trailer stacked up. So some of that stuff doesn't even use energy, and it doesn't burn fuel. Some of it does. But again, when you get down to the local ordinance of it, and you get down to what the backup generator is traditionally, I think that there's already a couple different layers, if not 3, maybe 4 levels of regulation in this. So I would support the bill.
Thank you. Further comments or discussion and/or action from the committee?
Madam Chair,
Yes, Senator Hone.
I make a motion to move to the 41st day.
Is there a second? Second. So it's been moved and seconded that Senate Bill 193 go to the 41st day. Comments on your motion?
I have faith and trust in our Public Utilities Commission, and I've been through some of their processes, and I know what they are looking at, and I agree that, we're looking at more than just the connecting aspect of it, and so that's the reason behind my motion.
Any further comments on the 41st day motion?
Substitute motion.
Go ahead.
I'd make a motion do pass.
Comments on your motion?
Yes. I'm just gonna kind of circle us back here and talk about the things that the good commissioner mentioned there that are regulated. He went through a number of things there, and obviously I am stressing the difference between connected to the utility or connected to the grid and not connected. What I'd also say is that all those things that he talked about that were part of their regulation process are already handled by either the feds or local. So these things aren't going unchecked. There's plenty of process that are happening by the feds, by the locals, and by Danner on this process. And so we are seriously talking about over-regulation when we look at this.
Thank you. Further comments on the do pass motion? Seeing none, I will ask the secretary to call the roll. Those in favor of the motion do pass on Senate Bill 193, please say aye. Those opposed, no.
Senators Milhoff,
Aye.
Dibert,
Aye.
Hone,
No.
Carr excused, Kobeck,
Aye.
Larson. Aye. Perry,
No.
Peterson,
No.
Crabtree.
Aye.
Madam Chair, we have 5 yeas, 3 noes, and 1 excused.
With that, Senate Bill 193 will go to the floor with a do pass motion. And I'll turn it back over to the chair.
Thank you, Senator Peterson. That concludes our work for the day and our last hearing for Senate Commerce and Energy before crossover, and we are doing it on time. So I would just give a huge thank you to the committee. Senator Perry.
I'm going to move to adjourn, but I first want to say that we've been very fortunate to have you as our leader. We've had
Well, thank you, Senator. I'm looking forward to working on the House bills with all of you guys starting next week. With that, the chair would take a motion to adjourn, moved by Hone, second by Peterson. All those in favor say aye. Aye. We are adjourned.
As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB.